finance service adheres to the principles of Islam as a form of social responsibility. Yona Islamic Microfinance is the Islamic microfinance of choice in the Gambia, trustworthy and reliable. At Yona Islamic Microfinance, we provide savings products, current accounts, financing products in conformity with Islam. In addition, Yona Islamic Microfinance also offers local and international remittances, Takaful Fund, management of Zakat, management of Awqaf.
And once again, thank you so much. I cannot stop saying thank you, because I am just happy with what I have seen. Even though we had sleepless nights, but we are really impressed, and the outcome of our preparation surpassed the efforts we have made. So this shows that even if we had not had sleepless night, we will still have a full and committed hall. So on that note, we are very much grateful, and we are happy. So in the program today, maybe we will allow the police band to give us one more nice thing, then from there we will move into our program proper. Thank you so much. First and foremost, we would want to welcome our international guests once again in the Gambia. We hope you're having a nice stay in our country, and then I hope you will go home with one or two words of the Gambian language. When I come to Kenya, I'll make sure I see you and ask you how many words are you still left with, because I came with many, but I cannot remember one now. All right, thank you so much. And then to Nadede, we welcome you. She's the one that came from Ghana. She's also here with us. So on the program today, we have experience sharing with our sister countries. They have been doing very well in social protection. We went there, we saw what is happening there, and we are impressed with what we have seen. So we believe our sector in the Gambia should also see and know what is happening in those countries. Generally, if you look at Africa, Ghana, Kenya, and some few other countries are powerhouses when it comes to social protection. So on that note, if we want to reach there, we will have to learn from what good they have been doing so that we can also adjust to that. So that is why we have them in our midst today to take us through what they are doing good in those various areas. So for Kenya, we want to know the Inua Jamil program. That is their government cash assistance program that is happening in Kenya, and it is covering as much people as possible. And then this is something good that every country that wants to support the poor, vulnerable, elderly, and so on need to learn from. On Ghana, we went there and then we were working on a grievance redress mechanism structure in the Gambia here. We wanted complainants, we wanted people that are benefiting programs to have access, opportunity to complain if they feel whatever is happening is not going right. We started this structure, but when we went to Ghana, we realized that what they have is unique, and then we also want to learn from that. So today we are going to witness these two experience sharing sessions. After that, we will review the call to action paper. The output of this program, this 3 days conference, is to come up with a call to action paper. This call to action paper we are going to present to government to say the convergence have agreed on A, B, and C. So we will read it through, you look at it, whatever you feel we need to adjust, we can adjust. Whatever we need to remove, we can do the same, so that it becomes what is agreed from this conference, not from our rapporteurs or from NSPS. And after that, we will now enter the closing ceremony, the closing session. In the closing session, we will have the national coordinator, who I believe already is very happy to say he is happy or he is not happy. But I believe he's coming here to say he's very happy. And that is the vote of thanks. And then after that, we will have the handing over of the call to action paper, and then the closing remarks by the Vice President or any minister he is going to delegate to come here today. So that is the program for today, and I hope we are all ready and prepared for the day today. We hope if things goes well, we finish by lunch, we all go to our respective places. So thank you so much once again for coming and then for being with us throughout this ceremony. I don't know whether you know my name. Okay. I am Malang Jiao. I am the Communication Officer at the National Social Protection Secretariat, stepping in for our able moderator. So thank you so much. We will move straight to the program now. We will want to invite I want to welcome Jacinta Omondi. Please give her a round of applause. Jacinta is coming from the National Social Protection Secretariat in Kenya. And he is joined on the stage by Paul Njorongi. Am I right?
Yes, yes.
Okay. Directorate of Social Assistance, and then they are the ones that are responsible for the Inua Jamil. So, Madam, you will want to come here?
Okay, thank you. Good morning. Habari ya asubuhi. That is the Kiswahili word for good morning. So I'm happy to be here. As you have heard, I'm Jacinta Omondi. Jacinta is from the National Social Protection Secretariat, Kenya, the same we have here. So I just wanted to say that at the National Social Protection Secretariat, our mandate is policy and legislation for social protection programs. And apart from that, we do coordination. I was very happy when the panelists were here and were talking about different programs in social protection. So we also coordinate the same, and there are some that we also do ourselves. So for today, I know we work with the different departments, very many programs, but for the Gambian case, we'll only be here for one program, that is Inua Jamii. So for those who understand Kiswahili, Inua is a Kiswahili word for uplifting. You uplift. Jamii is families. That is families, so uplifting families. So normally when we want to brand programs, we go to the Kiswahili way. We now move away from English, give them Kiswahili, because Kiswahili will reach the grassroots all over. So even if you get an older person ask about Inua Jamii, they understand this program. So that is why we are here today. So the department we coordinate that does Inua Jamii is the Directorate of Social Assistance. And that is where my colleague Njoroge Paul comes from. So with that, I would give Njoroge a chance to come and take us through the Inua Jamii program so that we understand it. So with that, Njoroge, karibu.
Thank you so much.
Yeah, thank you.
Thank you so much, Madam. Thank you so much, Mr. Njau, from the National Social Protection Secretariat of the Gambia. My name is Paul Njoroge Mwangi. As Mr. Njau and Madam has rightly put it, I work under the State Department for Social Protection and under the Directorate of Social Assistance, which is mandated to implement the National Cash Transfer Program. It's good morning, and allow me to greet you in the Gambian way. Nakasubasi. Yeah, Hassan is teaching me a lot of the Gambian language. He also told me Nangadef also means how are you. In Kenya we say habari yako. How are you is habari yako. Yeah, so in Kenya the Swahili is the national language, and English is the official language. Okay, even as we wait for them to set up. So I think the journey for Inua Jamii began sometime in 2004. And as Madam has rightly put it, Inua Jamii means uplifting the community. It began somewhere in 2004. During this time, the government was trying to address challenges that came up with the HIV and AIDS scourge. So the government piloted for the first time a cash transfer for orphans and vulnerable children. So you realize that out of the HIV and AIDS, we had so many orphans being left out unattended. So we had 3 main districts that piloted the program, and the first transfer value for the cash transfer by that time was around 500 Kenya shillings. I don't know how much that is in the Gambian currency. Dalasi, I think, we divide by 9 is very little money by that time, but it was being given 500, and then it was expanded to other districts, and later on in around 2007 it was actually rolled out to a national level. And then the next program that came up was the cash transfer for older person, came up in 2007 again, piloted again in 3 districts, but also rolled out in the entire country in 2010. And the last program that was piloted and also rolled out was the cash transfer for people with severe disabilities. That was piloted and rolled out in 2010. So basically, that is the genesis of the cash transfer programs in the country, in Kenya. So Kenya is, within the Republic, I think sorry. We have 47 counties. 47 counties. So the country is divided into counties. So we have the national government, and we also have the devolved system of government. So we have the devolved system of government, and I've interacted with two governors so far, and I also understand that you also have regional governments or regional administrative units. So in Kenya, we have a devolved system of government, and also we have the national government. So we come from the national government, I and Madam, but we have 47 devolved counties. Within these counties, we also have what we call constituencies. So we have 290 constituencies. So a county in Kenya is governed by a governor at that level. And then a constituency is represented in parliament by a member of parliament. So we have 47 governors, we have 47 senators, we have 290 members of parliament, we have 47 women representatives representing women interests at the county level. So that is the political structure and administrative structure in Kenya. So approximately 50 million in terms of the population. We're looking at, by 2019 statistics, about 36% of our population was living in poverty, and the cash transfer covers only around 2.4% of this population. So it's a small number. So, like I said earlier, we have, at the national level, you have 4 cash transfers. We have cash transfer for older persons, cash transfer for persons with for orphans and vulnerable children, and you also have cash transfer for persons with severe disability, as well as the hunger safety net cash transfer. Thank you. So the hunger safety net cash transfer is implemented in a different agency called the National Drought Management Authority. I also heard that you also do have an agency that manages the drought-related issues in the Gambia. We also have an agency called the National Drought Management Authority that actually implements the hunger safety net cash transfer. So this hunger safety net is not a national program. It doesn't cover all the counties. It is actually in 4 main arid and semi-arid counties in the northern part of Kenya, counties that have severe drought and famine. So they do cash transfer for families there. It is expanding to 4 additional arid and semi-arid counties this financial year. The cash transfer programs are actually anchored in our own constitution under Article 43 and Article 21 of the Constitution of Kenya, and of course their flagship projects under the social pillar of the Vision 2030. So in the country we have a vision that has been spelled out. We call it Vision 2030, that actually spells out some of our targets that we want to achieve as a nation. Of course, we are guided by the policy of 2011, the Kenya National Social Protection Policy, but which is currently under review. So we might be having very soon the 2023 version of the policy document. Sorry. The vision, mission, and overall objective of the Inua Jamii program. Vision is to have a society where poor and vulnerable persons enjoy their rights and live in dignity. The mission is to effectively and efficiently deliver cash transfers to the poor and vulnerable persons in the country. And the overall program objective is to provide social protection system through regular and predictable cash transfers to poor and vulnerable households that take care of overseas, older persons, and people with severe disabilities, with aim of building their capacity to be able to live a life of dignity and exploit their human potential. So basically that is the overall objective of the program, and of course mission and the vision of the Inua Jamii program. So in terms of the institutional arrangement, of course, we are at the national government level. So we have a ministry. It's called the Ministry of Labor and Social Protection, which is headed by a CS, that is a cabinet secretary. Then we have the State Department of Social Protection and Senior Citizens Affairs, that is headed by a principal secretary. And of course, the National Social Protection Secretariat, that is headed by the coordinator, National Social Protection Secretariat. We have under the National Social Protection Secretariat, we have a National Steering Committee on Social Protection. And of course, now the Directorate of Social Assistance, where I come from, that is actually is mandated to oversee the day-to-day implementation of the cash transfer. And under that, we have the administration and communication aspects of the program. We have the targeting, enrollment, and recertification. We have management information system. We have the funds management and payments. We have grievance case management, and as well as monitoring, evaluation, learning, and research. But at the county level and sub-county level, we have officers manning who are in charge of the program. You realize that at the national level, we have a lean team of officers, but the actual implementation of the program happens at the county and sub-county level. So we have over close to 1,000 officers spread across the county and sub-county. So we have regional county coordinators, we have county coordinators, we have sub-county coordinators. So I had given you the history of the cash transfers. I think my screen there has shut off, so I'll still use this. So so I had given you the history of the cash transfer, so that one I will not really go into. But in terms of the growth, in terms of numbers, you can be able to see that from 2000 and we have grown in terms of numbers. 2013, you can see how the numbers have been coming up to 2023. This is just a snapshot of the growth, just to indicate how the numbers have been coming. So since 2013-14, we have had a series of scale-ups, what we call scale-ups or additional, bringing on board additional beneficiaries. So in 2015-16, we had a scale-up of older persons cash transfer and CTOVC, as well as persons with severe disability. And as late as this year, we have also had a scale-up. So you can see the number has grown from about 516 in 2013-2014 financial year to around 1.33 million households. So if you multiply by the average household size of 5 members, you can see the numbers are over close to 6 million beneficiaries across the country. So that is how the growth has been over the years. The transfer value has also grown. So we began with a pilot of 500 shillings, Kenya shillings, in 2004. And today we are doing 2,000 shillings per month. That is equivalent to approximately 13 USD. And then maybe in terms of the Gambian currency, I think it's around 120 or something, thereabout. Dalasi, maybe, if you convert with the current exchange rate. But for the hunger safety net, I think for them, they are a bit higher in terms of the transfer value. Sorry, it's not 13 USD, it's around 18 USD. So because for them, they give 2,700 in the arid and semi-arid area per month. So payment is done every month. So this is a departure from bi-monthly payment. So we used to pay every 2 months. We used to call them cycles of payments. But since the new government took over, I think one of the pledges that the president gave, and those people who attended the conference in around April, you recall the president pledging that payment for all social assistance programs will be done before any payments of any civil servant. And the president has actually made sure that this happens, so we have been paying before civil servants are paid. So we have been consistently paying since July up to today. We've paid every month before civil servants get paid. That's the commitment for the president, and it has actually happened. So this one has really helped in terms of predictability of the disbursements, and people can now be able to, the beneficiaries can now be able to plan ahead of receiving the cash. So I had mentioned earlier that we have a system that actually supports in the terms of the implementation, the day-to-day running of the program. It's called the Consolidated Cash Transfer Management Information System. Why consolidated? Is because previously these programs used to be implemented by different agencies or departments within the ministry. For the orphans and vulnerable children cash transfer, we used to have the Department of Children's Services implementing the program, so they had their own management information system. For older persons, we had Department of Social Development implementing, so we had our own management information system. And for the person with severe disability as well. But in 2016-2017, there was a consolidation strategy that was designed that actually informed. One of the recommendations of the strategy was that we need to come up with a system that is talking for all the programs. And that's how the Consolidated Cash Transfer Management Information System was actually conceived, designed, and rolled out. So currently, all operations of the cash transfer in Inua Jamii program are actually run through the Consolidated Cash Transfer Management Information System, popularly known as the CCTP MIS. So this is just a tool that automates the operations. Like I said, it has several features. There's a beneficiary registration and management, how you identify beneficiaries, how you do targeting, and so on and so forth. There's a whole module for that. There's the payment, processing, and disbursements, how you generate payrolls, how you do pre-payroll checks, and how you communicate with the payment service providers, and how you get reconciliation reports. That one is also done under that. There's the element of the program monitoring and evaluation. There's a whole module for M&E, data integration and interoperability. There is the way in which the system speaks into other agencies and other government databases, such as the civil registration, the IPRS, that is the Integrated Population Registration Services, that actually stores all the national IDs for the country. We have the National Registration Bureau, and so on and so forth. So this system speaks into those agencies so that we can be able to do data validation, data verification, and so on and so forth. Of course, there's the element of security and data privacy. So the system also makes sure that there is a lot of security as far as data for beneficiaries is concerned. Within our country, we have the Data Protection Act that actually makes sure that you cannot manipulate or share sensitive data belonging to beneficiaries without express authority from the relevant agencies. So that is basically as far as the system is concerned. We might not go so much into details about how the payrolls are generated and so on and so forth, but at least I'm giving a high-level picture of how the cash transfer is run. There's also a module under the targeting, enrollment, and decertification. So this is now a module that is responsible for identification of potential beneficiaries, the registration of the same beneficiaries, enrollment of the same beneficiaries, and also the recertification aspect of the program. So targeting, as we already know, and I think yesterday we were taken through the process or the pros and cons of the targeting processes and the methodologies. Enrollment is just basically onboarding beneficiaries into the payment platform. And of course, recertification is actually the element of reconfirming the welfare status of the beneficiaries or households for that matter. So we do targeting, that's the process. We do enrollment, we do payment, we do recertification. But along the way, there is the element of the grievance and redress mechanism, there's the element of the communication, and of course, monitoring, evaluation, research, and learning. So that is basically how the process flows. The eligibility criteria for the older person's cash transfer, I know yesterday there are people who participated in one of the breakaway sessions, and one of the speakers mentioned the issue of the older person's cash transfer in Kenya, and the aspect of universality of the same. So we have, for the older person, you must be a Kenyan citizen, of course, identified by the national ID, and you must be 70 years and above for you to participate in the program. You must also have a caregiver who has also a valid Kenyan national ID. The reason why we introduce caregivers is because over time, these people grow weak, and they want somebody to assist them to go and pick the stipend on their behalf. So if you define a caregiver in the system early enough, then they'll be able to support that particular older person in future whenever they cannot be able to reach the pay points and so on and so forth. But this particular program here, we do a pension test on the same. So we check, pension check. So all those people who have previously worked for government and they're earning pension are not eligible to join the program. So that's the only check that we do. Otherwise, anybody else is eligible to join the program. Of course, there are so many questions of we have wealthy business people who can still join the program and so on and so forth. So areas of inclusion, as we were being taken through yesterday. So you'll find those cases here of a few Kenyans who want to join the. So in Kenya, there's this feeling about this program that the government is giving back to Kenyans, senior citizens, because of their contribution, immense contribution into the development of the country. So everybody is entitled. I should be benefiting. So there's that feeling. So in fact, some join the program not necessarily because they really need the cash, but because it's a recognition aspect. The government is recognizing me as a senior citizen. So that card that I'm given is a prestige. It's prestigious to some of them. So you'll still find people who still have large tracts of land, businesses, and so in this program. And those are some of the errors that we're living with. It's because of the policy, again, the government policy. But before the 70 years and above program, it used to be poverty tested. So it used to be 65 years and above, and we used to apply the process of targeting. So it was poverty targeted. But come 2017, 2018 financial year, the presidential declaration said that anybody with 70 years qualifies to join the program, and that's where we are. We have the eligibility criteria for orphans and vulnerable children cash transfer. So here we apply the poverty test. So here the household must have somebody who is an orphan or defined as an orphan and vulnerable child who is a permanent member. The household can either have somebody who is chronically ill, who is a caregiver. In the case of TB, HIV and AIDS, those are the chronically ill conditions. Household should not be benefiting from any other social assistance program. So we always check for double dipping so that you also don't get HSNP, you're getting OPCT and also getting OVC and so on and so forth. Again, we also check that households has resided in one particular location for more than 1 year. This is to avoid issues of destabilizing the numbers in terms of their location. So when we are moving out to do targeting, we have what is called a targeting plan. So a targeting plan has numbers. Numbers have been agreed upon through consultations with various stakeholders. So we discourage members moving from one location to another whenever you are doing targeting, so that we can at least maintain numbers per quarters as per the targeting plan. So that's why we say you must be a resident of a location for a period of about 1 year. Then we have the criteria for person with severe disability cash transfer. You must be extremely poor household, and that particular household must have at least one person who has severe disability. That is person who needs 24-hour care and protection. That is how we define severe disability. 24-hour care, somebody who needs 24-hour care and protection. Of course, you should not be benefiting from any other cash transfer program given by the government. You must be a Kenyan citizen, of course, and you must have resided again in your location for a period of about 1 year or 12 months. So that's as far as the criteria is concerned. And then we have stages in terms of targeting exercise. This is just high level. There are nitty-gritties into this, but these are just high level. So for us to identify beneficiaries of the program, or potential beneficiaries for that matter, we do two processes. We do household listing, and we also do household registration. So traditionally, we have been doing it as a program, but of late, we have what is called the Enhanced Single Registry. So Enhanced Single Registry has already done household listing in 23 counties nationally. And they have used both census and mass listing and registration. So they have done household listing and household registration in 23 counties. So they are yet to do in 24 counties to make it 47 counties. But as a program, previously, we used to do household listing as a program. So Inua Jamii used to go to the ground and identify beneficiaries. So household listing is done in a community meeting. We normally call them barazas. I don't know how you call them in the Gambia, where you call communities from a certain village or several villages, you invite them in a place, and then you apply a tool called the listing tool, which is a digital tool. So you go with a tablet and then you list all of them. You say, we want to list people for City of VC program, and this is the criteria. And then everybody presents themselves. Whoever presents themselves, you just list them. And then after listing, you do now household registrations. Now household registration is now moving from door to door, household to household. Now you administer another tool. We call it harmonized targeting tool. So within the social protection environment in Kenya, we have what stakeholders have reviewed and approved, a tool to identify potential beneficiaries for social assistance or social protection interventions. And that tool is called the HTT, the Harmonized Targeting Tool. Of course, derived from the Harmonized Targeting methodology. I can't remember the name of the presenter who talked about the issues of PMT, issues of means testing, community-based validation, and so on and so forth. So that particular methodology is what we also have developed in Kenya, and that is what guides any other identification of potential beneficiaries for social protection intervention. So we apply that tool at household registration, and of course now that information is relayed again electronically from the county and sub-counties to national servers, where we now run what is called the poverty ranking. So we run the PMT calculations and we do poverty ranking. After poverty ranking, we take that particular ranking back to the community for what is called community-based validation. Well, now the community will say that person is ranked correctly, or this is more poorer than this, and so on and so forth. We take that, and then that's now when you do the enrollment. But now that particular enrollment is based on the numbers. So if the government has, for example, in this financial year, the government has given us additional numbers, 500,000. And I think those people of us the Gambians who attended the conference, you remember the pledge the president gave of scaling up the program by 1.5 million. So to make it 2.5 million by 2025. So already this year, we have been given the go-ahead to bring on board 500,000 additional households into the program. So those 500,000 are actually divided by quarters And every county, every sub-county is given their numbers based on poverty indexes and so on and so forth. So I have talked about the expansion plan, community sensitization, there's a household listing, and of course household registration, and of course finally the enrollment. So the enrollment aspect is now where you get the potential beneficiaries who have gone through all these identification process, and now you onboard them. You give the details to the banks go and open bank accounts for the beneficiaries. That is the enrollment process that we are talking about. Of course, within this process, there are several activities that happen. There is the development of the expansion plan. This one is done at the national level. There is the stakeholder sensitization, also both at national and county and regional levels. There is the recruitment of the locational targeting committees. These are people who are community members who form committees at the locational level. I don't know which is the, in Kenya, the smallest administrative unit is called allocation. So there are members who are identified at the location level. So allocation is made up of several villages. They come together and form allocation. So members, community members identified in those regions, they form a committee to oversee the targeting and identification processes for the program. And then, of course, after that, there is the recruitment and training of enumerators. So much of this work is done by enumerators who are recruited and trained, and of course supervisors. And then there is the household identification and listing. So those are some of the processes that happen during the targeting process. Community-based validation, that one there's a community-based screening. This is now where you go and correct any data. So after listing, we normally send this data to the National Registration Bureau or the Integrated Population Registration Services, the custodians of all the registration data in the country. So you tell them, check, we have listed this person here. His ID is this and his names are this. Tell us whether indeed that is a legitimate Kenyan. So they run that and they give us feedback that yes, 90% are legitimate Kenyans. We have mismatches for the 10%. So we send this data for the 10% to the sub-county officers for them to check and correct and then submit back to us. Because one of the conditions is that you cannot be enrolled into the program unless you have been positively identified by the National Registration Bureau. Then we have the registration aspect, the community-based validation aspect, and finally the enrollment aspect. I had mentioned this earlier. We have a mobile application that we normally use. So we have an application embedded on the mother system, the MIS, that helps us in terms of the identification process. So we don't do manual paperwork. So we do digital data collection. Of course, there's the element of the enrollment. This is now where we share the data with the banks. Then the banks are able to onboard beneficiaries. So there's the element of the account opening, the element of account submission, and of course, an account verification. So at the national level, once we have now the file of potential beneficiaries and we have agreed that these are people who are going to join the payment, who have joined the program and are ready to be paid, we share the list with the banks. So we have 6 contracted payment service providers. They are commercial banks, contracted by the ministry to deliver cash. So we give this file to the banks and they are able now to mobilize the beneficiaries and open bank accounts for them. And those accounts are submitted. There are standards for submitting the accounts, so they must meet what we call the KYC, Know Your Customer standards. So they're submitted to our servers, and then we verify that indeed these accounts are true and they are correct. Then we onboard that beneficiary. So that beneficiary from there is ready to join the payroll from there. The issue of recertification, this one is, we have a module for recertification, but we have never had an opportunity of doing actual recertification to our beneficiaries because one, I think it's a costly exercise, but two, I think the program has been growing very fast in terms of the transition. So we have not had an opportunity where we can actually carry out certification, because every time we are either bringing on board additional beneficiaries, we are transiting from this payment model to this payment model. So we've never had ample time in terms of conducting a recertification. So, but we still have a recertification module, and we are looking forward to doing this maybe in a phased manner. But importantly, we have the enhanced single registry in place now, which can also support us in terms of doing the recertification. So we might not even need to go to the field to collect data. We can just run data, the current data for Inua Jamii against the enhanced single registry, and we're able to get recertification data or status from that particular process. Then we have the payments aspect. We have moved from manual to electronic payment over the years. So in 2004, when the programs were being piloted, we used to pay through district treasuries. So money would be sent to officers manning sub-counties or districts for that matter in their bank accounts. So they'll go and cash it out, then they put it in their bags. They hire a police officer and a land cruiser. They go to Marsabit and any other county for that matter and deliver cash. It used to be very tedious. Of course, there were elements of error, fraud, and corruption within those processes. It was also risky. Some of the officers used to be mugged because the thugs would know when the monies are being disbursed, and so on and so forth. So it was tedious. But we moved to the National Postal Corporation of Kenya. So the Postal Corporation in Kenya has branches in almost all districts. And therefore, the government contracted the Postal Services Corporation of Kenya to disburse the funds. It was also manual because we used to print payrolls, and then we in 3 copies, and then you move 2 copies to the Postal Corporation. Then they send the payrolls by courier services to the branches at the district level. And there were a lot of errors, there were a lot of problems. Beneficiaries did not authenticate well. They were used to do fingerprints. So there were some crooked guys who would put fingerprints on behalf of the beneficiaries and go away with the money. So it was a bit of a problem there. So again, in 2016, we contracted 2 commercial banks. Now a bit of electronic element was introduced here, because they opened bank accounts for beneficiaries, printed electronic payment cards, and now they started what we normally call the 2-factor authentication. The other 2 processes were manual. We now had some form of authentication where you have a card, you have your national ID, then you present yourself to the agent, you are given your cash, and then the reconciliation aspect, the bank would send the reconciliation reports to the ministry's system, MIS, for reconciliation purposes. But now moving to around 2017, 2018, there was an urge to even improve this further, and we introduced what we now call the choice model of payment. So in terms of the choice model allows the beneficiaries to first make a choice of the payment service provider that they want, maybe that is nearest to where they are, and so on and so forth. But also importantly, it gives the beneficiary that window to be able to collect funds within 6 months without being pushed. So you can stay without being asked. So the other model we used to recall money. If you don't, for example, collect in 21 days, 3 weeks, we used to recall money back to the ministry's account. But in this new model, called the choice model, we allow beneficiaries actually the money can stay up to 12 months actually. But on the 12th month, we now claw back. If there's no activity in the bank, we now claw back the funds to the ministry's account. So this one gives the beneficiary a bit of time to also manage their accounts and their resources. It is 2-factor authentication. The primary mode of authentication on this particular model is biometrics. So all the payments that are done by all the banks usually use the primary mode of authentication is biometrics. Of course, upon customer request, we can also issue PINs. The banks can also issue PINs, and beneficiaries can also move to ATM machines to be able to collect their funds. They can also move over the counter where they can be identified by the banks and they're given their stipend. So these cards that we print for beneficiaries, they are actually EMV, Euro Money, Visa, and MasterCard compliant. So beneficiaries can also withdraw across other banks, not necessarily where they have opened bank account. So there's the element of the interoperability between the banks, although it's not fully realized, but there's that aspect of interoperability. In future, we also want to expand this even more and also look at how we can also bring in the mobile money solution into the payment. Because you realize that within the terrain, some terrains within the country, there are areas where banks are not present at all. Even their agents are not present, but mobile money service providers are present. So we want to open this up in future to even include mobile money transfer. In terms of the payment delivery mechanism, we have issues to do with liquidity management. So we were looking, when we were contracting these service providers, we looked at how liquid the service providers are, how the distance to pay points, how near or far is it from where the beneficiaries are. Of course, issues of competition among PSPs, and the issue of the beneficiary choice was also a factor in terms of designing the model for the delivery of cash. So within this account-based model, called choice model, there are some salient elements, and one of it is there is a beneficiary choice, as I said. There are unique account features like free withdrawals, free balance inquiries, and so on and so forth. There is the issue of access to services, the use of biometric standards. There is the element of the proof of life. Proof of life is, I don't know how advanced your births and deaths registry is, but in my country, the births and deaths registry is not digital. But they're in the process of digitizing it, but it's not digital. It gives us, it's one of the greatest challenges for this program, actually. Because I cannot tell you from where I stand how many of my beneficiaries have passed on. Because I need to rely with the district registrar of births and deaths. And the district registrar of births and deaths relies on the chiefs. I don't know whether you guys have chiefs at the village level, at the district level. So for us, chiefs are at location level and sub-location, chief and assistant chief. So whenever there is a reported case of death, so the chief issues something called the burial permit. Okay, burial permit. The authority to bury somebody is issued by the chief. Of course, in some Islamic regions like northeastern in Kenya, chiefs don't know usually. They just usually give them after the burial took place because of the culture of the religion. But basically, they are the ones who are mandated to issue burial permits. Now, after they have issued burial permits, they inform or update the office of the registrar of births and deaths. Then the office of registrar of births and deaths now books that particular case. Now, before it gets to Nairobi, where the headquarters of the births and deaths are, it's a long period of time. By that time, maybe I've run 2 or 3 payment cycles, and the person was declared dead. So you can see there's an element of the loss of funds. Let me put them loss of funds or misuse of funds, because why are you sending money to an account whose beneficiary is a long time dead? So that is a big challenge for us in terms of this program. But we are happy because the civil registrar, the one in charge of the births and deaths, is actually now in the process of digitizing the registry. so that we will now be just needed to, through an API integration, system to system, we'll now be able to do verification quickly. So we'll no longer rely on the county and sub-county teams in terms of informing us who is deceased and not deceased. So proof of life becomes a very integral aspect in terms of the disbursements, because we want to know who is this person still there? So just to address that particular problem, we told the banks that within 1 year, do proof of life for us. Make sure that the beneficiaries themselves, the primary recipient, comes to the bank to do biometric. Because now when they do biometric, at least you know they are there, at least twice in a year. The other times they could go and get cash from agents and whatever, and they can use their caregivers. But at least twice in a year, let that person do a biometric capture, a transaction, biometric transaction. So that's how we have been doing the proof of life using the bank account, using the payment service providers, that is the banks. Of course, there's the element of real-time monitoring in terms of the disbursement and the zoning of beneficiaries to incentivize the PSPs. So you see, when you are doing contracting these banks, every bank would want to participate in this particular payments, this particular service, because of the movement in terms of the amount of money that is involved. And banks want money to go through their accounts. So they will tell you, no, I will be able to do this, but ideally, maybe you realize that they don't even have presence in some areas, but they have told you that. So we designed an aspect of zoning. So we took the country, split it into 3. We say zone 1, zone 2, or zone A, zone B, zone C. And in those zones, we actually, I'll be showing you the zones. We actually identified the agents every bank has in those particular zones. And then in very far-flung areas, we told the bank, hey, look, we are willing to pay you more money to deliver cash to these beneficiaries. So the bank said, really? Yes, we will pay you for example, a transaction, 150 Kenya shillings against other regions, say 100 shillings. Maybe in Nairobi, which is the city, we are paying a transaction at 100 Kenya shillings. But we are willing to pay a remote area transaction at 150, for example, so that the banks are willing to, send agents to those particular areas so that we can be able to deliver the cash. So that is the element of zoning of beneficiaries to incentivize the banks. So of course, the choice model has the element of saving, because it has what we call the store of value. The banks, the accounts, they have no ledger fees is charged, free balance inquiry, like I said. And every year, we give our beneficiaries an opportunity to choose any other bank that they might want. So maybe they were mistreated in this bank, they can always every year choose to move to another bank. So that one is already there. So we call it annual switching of preferred payment service provider. That one is there. And of course, the issue of the interoperability, you can withdraw from any bank that is contracted. You don't have to really withdraw. So if you find yourself in a region where there's this bank and your card belongs to another bank, I said earlier, it is EMV compliant, it is Visa, Europay, and MasterCard. You can be able to withdraw from any other bank. So there's the element of interoperability. There's also the element of biannual switching. There is also free balance inquiry, and you can be able to retain money within your account, that is savings. Free ledger fee are also there. So this zoning I was telling you about, we have over 2,700 locations in our country, but after 2019 census, I think they have grown to 3,400 locations. We have mapped them into 3 zones based on the distance from existing service providers, and the commissions paid to the bank are also banded. We call them bands. So Zone A has its own band, Zone B is band, and Zone C has its own band. So in terms of bands, so you can see, for example, in Zone A, a transaction of Kenya shillings 500 to 400 shillings attracts a commission of about 3.67 USD. That's like 29 Kenya shillings. That is 3.67 to 29.41 USD. That's close to 110 Kenya shillings. The same transaction in Zone B is 125 Kenya shillings. The same transaction in Zone C is 130 Kenya shillings. And they got that based on the amount of money and the amount of transfer. So if you are moving, for example, if you look at number 7 there, if you are paying a beneficiary household between 24,000 to 30,000 Kenya shillings, then in Zone A you will be charged 120 as commission, 132 in Zone B, and 154 in Zone C. So you can see the amount go increasing based on the value of transfer and also the distance or the zone. So that's what we call now the band. So that at least the bank that does more work in terms of delivery of cash. For example, there's a location in Kenya in a county called Marsabit, one of the northern counties, which is around 600 kilometers from the county headquarters. There's a location that's 600 kilometers from county headquarters, one location. So there's one bank that is present in that particular location. Of course, you need to pay them better commission for the investment that they have done in terms of setting up agency in in that location. So, as I said earlier, we do monthly payments. We used to do by monthly payment, but now we do monthly payments. There's two programs here you are seeing called NICHE, that is N-I-C-H-E, we call it NICHE, that is in full nutrition improvement through cash and health education, and there's the other one called EIP, that is economic inclusion program. Those ones, we will talk about them later, but these are complementary programs. They use our system, the cash transfer for Inua Jamii, to disburse their money. So what we are also doing is that we want to enhance the system so that any other disbursements the government wants to make in future, instead of going to come up with a system of disbursement, they use the Inua Jamii system for disbursement. So it's like specialization. So the ESR will specialize in terms of identification of potential beneficiaries. And now CCTP will specialize in terms of disbursements for Inua Jamii, for any other cash transfer interventions. Like I will tell you, maybe there was a program called the Universal Child Benefit Program. We also used this particular system to disburse. So that is historically how the payroll has grown in terms of the amounts and the number of beneficiaries. So in 2004, 2005, we had only 500 beneficiaries during the pilot of the program. But over the years, the number of beneficiaries have grown due to scale-up activities up to the recent one, 2022-2023 financial year, where we have on the payroll around 1.1 or 1.072 million on the payroll. But after this financial year, we'll have more because we are bringing on board 500,000. And we are replacing the lost ones who have died due to attrition. So we are looking at a payroll of about 1.7 million households in this particular, by the end of this particular financial year. In terms of amounts, again, the amounts have grown. So over the years, I think, since the inception of the program, we have disbursed close to 1.51 million USD. That is close to 217 billion Kenya shillings over the years. So that's what we have been able to disburse. And you can see the growth in terms of the financial year since 2004-2005 financial year. So we have 6 payment service providers, but all of them are commercial banks that do support us in terms of the delivery of cash. They have their agents and branch networks, so you can see for example, the first one is Cooperative Bank It has 157 branches with over 16,139 agents across the country, and so on and so forth, up to the last bank, the National Bank of Kenya. So we have, in total, we have 944 branches that do disburse our Inua Jamii cash, with over 59,755 agents spread across the country. That is the same as the previous slide. So we have, how do they access the funds? We have the agency, banking. We also have what's called the over-the-counter withdrawals. We have cash in transit. In very remote areas, the banks do cash in transit. They put money in their vehicles, armored vehicles, and so on and so forth, and of course security, and they push money to those far-flung areas. We also have communities that have the cultures of the Fulani of the Gambia. We call them the Maasai, and we have the Rendile, the Gabra, who live in northeastern Kenya. So some of them moved to look for pasture for their livestock, and they can go many kilometers. So when they move, you have to move with them whenever the cash is there and take money there. So we have cash in transit as well. Of course, we have ATM withdrawals in some instances, and also we have mobile money transfers. So every account that is opened for the beneficiary and recipient has mobile money capability, because all banks provide mobile wallets. So you can be able, again, upon request, you can be able to get mobile money transfers using that. I'm not sure whether I need to be advised in terms of time, whether I'm behind or ahead of time, but so that I can. Okay, thank you. So we also have the grievance and case management, so that actually tracks all the grievances, complaints, and updates related to our beneficiaries. And we have tools that do that. We have forms, and these forms are both digital and physical. And the issues of grievance, complaints, and updates are tracked from the sub-county and location level. We have officers manning location and sub-counties, so they track this and they put in the system. So the grievance and case management module is decentralized, meaning officers can be able to capture cases from the comfort of the sub-county and location wherever they are, and they are able to log that case and they escalate it to the relevant office, either county or national office. Same case for complaints and updates as well. So they go through the escalation process. There is the SLA, what we call service level agreement, for the cases to be resolved within a certain stipulated time frame, and we are able to capture those cases in the system and refer them to the relevant offices, either the bank, either our service providers, or our own officers at the county and sub-county, as well as national level. So the members of the public can report issues of complaints and grievances, as well as updates, by visiting our sub-county officers in person, or through what we call the beneficiary welfare committees. So we have another structure we developed because of issues of these complaints and grievances. So beneficiaries have formed committees by themselves. I'm a recipient of Inua Jamii, and we are 10 of us, or we are 20 of us in a small village, or we are 50. We come together. We are recipients. We come together. We have common interest. We are beneficiaries of a cash transfer for the government. We form an association or a group. Now, this particular group is the one that now will track issues of complaints, issues of updates, and inform the relevant office, our office now. We developed this structure because, one, we realized that beneficiaries were not aware of the program on how it is being implemented. So you would just go to a village and you see beneficiaries are more vulnerable, and that one gave opportunity to conmen, let me call them conmen, or tricksters, people who come and tell beneficiaries, I'm the one who put you in the program, and I can say you be removed. Give me 50 500 shillings, and so on and so forth. So we realized these things were happening and they were rampant. So we wanted to empower the beneficiaries themselves so that they can be able to man or to run their own affairs at that level. And that's why we came up with a beneficiary welfare committee. And in every location across the country, we have a beneficiary welfare committee. Of course, our sub-county coordinators and county coordinators are also used in terms of relaying some of these complaints and grievances. They are also sent through post to our offices, and of course, there's a toll-free line that we use to receive any complaints or grievance from the beneficiary or any other person or any other Kenyan. So we have a running toll-free line. We have a call center, actually, that we do address issues of the grievance and redress mechanism. Of course, the same process follows in terms of updates. Updates are changes within the household condition. So there is a new caregiver, for example. A household wants to introduce a new caregiver. There's a newborn child. There's an exit of member, or somebody has passed on. Those are called updates. So we usually do conduct updates, and they go through the same process of escalation to the national office. So once these updates are done, they are communicated also to the banks, so that the bank can also update their system accordingly. I will not go into types of complaints because some of them are card-related, payment-related, identification-related, targeting-related, and so on and so forth. So every procedure, every process, from identification, registration, enrollment, up to payment, we have different categories and typologies of complaints. So that one I really don't want to discuss so much, but I want us to also appreciate that we have chiefs and assistant chiefs who also assist in terms of implementation of this particular program. So they help us in terms of, especially whenever we have major undertakings. Like for example, in a few weeks' time, maybe 2 or 3, we'll do mass account opening for the 500,000 that we have brought on board. So chiefs will do mobilization for us, will do the actual field plans for us, and so on and so forth. So they are very, very, very instrumental. So they also help in terms of reporting, in terms of abuse of our beneficiaries, for example, by their caregivers, because you realize there are some caregivers for older persons, for example, who abuse the older person or the beneficiaries. Even for a person with severe disability, an OVC, for example, they help us to address all those issues and report to the relevant authority. Whenever we have major activities, chiefs and assistant chiefs will provide security for, like, when we are moving door to door in terms of identification of households. They will move with us and to provide that particular, but also to tell us whenever there are major changes within the structure of the community. Yeah, thank you so much. The Beneficiary Welfare Committee, this one I will not really talk about so much because I already have addressed the issue of the members of the beneficiaries themselves forming committees. But importantly, I think over the years we have been able to, as key milestones, we've been able to develop. One of the key milestones for this Inua Jamii program was the development and decentralization of the Consolidated Cash Transfer Management Information System. That one was a major milestone, and already this one we have been able to achieve it, and we are using the system effectively to run the cash transfer. There is the element of the choice model. Again, this was a game changer, moving from the manual systems of disbursements to a more robust, a more friendly, and a more efficient payment model. Of course, the scaling up of the new additional beneficiaries as per the presidential declaration. We are bringing on board 500,000 additional beneficiaries this financial year. The change from the bi-monthly payment to monthly payment, again, is a major milestone because it has addressed issues of queuing, issues of predictability of payments, and so on. Now beneficiaries can be able to plan because they know money will still come. It's like a salary. So they can even go ahead and borrow from somebody, or even carry goods and products from shops because they know on this date we are going to receive our payments and so on and so forth. We have now, other than the grievance and redress mechanism or grievance and case management mechanism or module, we have what is called enhanced grievance and case management module. Now this one, we are going to allow any other player within the sector, social protection sector, not necessarily Inua Jamii, to be able to actually log in cases that actually affect Inua Jamii. For example, we have like a program called HSNP that is in northeastern counties. If a HSNP implementing officer encounters an Inua Jamii officer, they are able to log in a case. So there is already that module under development so that we are able to bring on board, to make it easy for beneficiaries to report cases without having to move long distances. So getting served within wherever you are by any officer, as long as it's a social protection implementing officer. So that is called enhanced grievance and case management. Of course, there are challenges that we have encountered over time, issues of funding. There is a huge demand for people to join the programs, but minimal fiscal space or no fiscal space for that. Issues of operations costs, of course, we are not able to be funded, and that's why, for example, we have not done even a good impact assessment or evaluation for this program, or even recertification for that matter. Issues of errors associated with identification and registration processes, they are there. Errors of inclusion, exclusion, limited impact evaluation, lack of interoperability under the choice model of payment. So the banks are a bit slow in terms of implementing interoperability. So we wanted a situation where money would move, not necessarily through the normal IFMIS system, but banks are able, once we run the payroll from National Treasury, or from our system and the National Treasury disburses money, we wanted a situation where any financial institution in the country can be able to pay our beneficiaries. We have not yet gotten there. We are still grappling with that problem, so interoperability is not yet there for us. Of course, there are issues of politics around the cash transfers, a lot of politics around that. And then there are issues to do with biometric failure, issues of failed biometrics during disbursements. Emerging issues, the government of Kenya is very keen in terms of the digital economy, digitizing most of its services. Already over 5,000 government services are already available on a digital platform. We call it eCitizen. Is an online platform where all government, you can be able to access all government services, including but not limited to Inua Jamii, for example. So we want to leverage on that, the move by government to digitize its services, and we want to also make it easy for our beneficiaries to also utilize digital solutions. For example, fintechs, companies who provide money, mobile money solutions, we're able to do that. But importantly, I don't know, and I had somebody today ask me, how is the hustler doing? As my president is popularly known across hustler. So he came up with a hustler fund. Hustler fund, when he took over office, there's a hustler fund where Kenyans can be able to borrow from government, small amounts, and they're able to pay back, they borrow more. So we are saying we can also be able to leverage on such platforms to be able to inform our beneficiaries that they can actually participate in some of these financial services that are being offered across by a financial service provider. And that is the element of the financial inclusivity of our beneficiaries into the mainstream financial markets. Having said that, I think I want to invite my boss to come and tell us a few things about other programs that we implement in a nutshell, and then we can call it a day. Karibu, madam.
Thank you very much. Thank you. I hope you have got our Inua Jamii, how it goes, and what happens in Inua Jamii. So mine is just 1 minute. I don't want to go so much into a lot of things. We just felt that it is good to say that from the National Social Protection Secretariat, there are other programs that we also coordinate related to Inua Jamii. because even yesterday, the presentations, you heard as it was being said, and we need to think about it. Is cash enough? What else can you do on top of the cash? So those are the programs I just wanted to mention, and there are 4 of them. There are 5. One has been mentioned a lot. The social registry for Kenya, that is called the Enhanced Single Registry. So the Enhanced Single Registry, as Mr. Njoroge had said, initially the registry was only taking care of the data for Inua Jamii beneficiaries. Then now we are improving it so that in future, even when we want the 500 per year the president is talking of, we don't go to Target. Target, yesterday you heard, it's too expensive. So we just get the beneficiaries and put them into the programs. So as he had said, we have collected data in 23 counties. We have 24 more to go. And we were hoping that by December 2023 up to March, we shall have done the 24 remaining, so that we have a good social registry for our social protection programs. I know there are quite a number of countries in Africa coming to learn on it. Recently we had Nigeria, Somalia, Rwanda, Zambia coming to learn on ESR. So it is something that as a continent we can look into, and from other areas also, and learn a lot on it. So that is one of the programs we have related to Inua Jamii. The second program, I like saying that human beings, we can't be static all the times. Is that so? We must move and we must try new areas. So there is the Universal Child Benefit Pilot. We are also undertaking. I don't know how many countries in Africa or in the world are having Universal Child Benefit. South Africa is one of them. I know there are countries in the world that have it. So for us, we were just trying to pilot. And as we speak, impact assessment is going on. So we piloted in 3 counties. And we were giving them 800 Kenyan shillings per child. OVC that you are being talked to about is per household. But this one is now per child, 0 to 3 years. And when we did registration, we worked closely with the Kenya National Bureau of Statistics. We found out that according to the census, which was the 2019, 0 to 3 years in the 3 sub-counties were around 8,333. So we took 8,300. And of course, upon registration, a mother would only have 1, 2, and at maximum 3 children if they are twins. So those are things we think of. And I want to believe a lot is going to be learned from there. Like in our manual, we said the money be given to a female caregiver. And already the men were up in arms. You think even us, we are not taking care of children. So those are lessons such that if we are to upscale it, we'll see how do you go about such things. And I want to believe that in every country in the world, UCB cannot be started at a go, because half of the population is children. Is that so? So you can't start it wholesome. How do you start it? Sub-locations, counties, slowly until after some years you reach the maximum of 18 years. So that is one program we are piloting, and a lot of impact assessment is going on. We want to see how it goes. The difference with OVC is that there is nutrition improvement, which is being undertaken by the Ministry of Health. We work together. Then the disability aspect was also taken care of. And third, we were also looking at child protection issues. When, for those families, child protection, how is it? Abuse, what? So all that is being taken care of, so that's a good one. Related to that, there is the nutrition improvement through cash and health education niche. So this one is being supported by World Bank. Also, we have it in 5 counties. Joroge mentioned it. So this one, health education, the beneficiaries are pregnant mothers, lactating mothers, and children up to 2 years. Those are the beneficiaries. So you give them 500 shillings on top of the Inua Jamii money. So some are Inua Jamii beneficiaries given priority, and some are just outside. So what else do you do? So that is a cash plus. The program will run up to March 2025. Then we'll see how can it be sustained. So that is also on social protection. Then we have economic inclusion program. Economic inclusion, this is also to the beneficiaries of Inua Jamii and outside. So under this one, the beneficiaries, they form groups. And the reason is that once you get the money, the way we have said 2,000, is it enough? Can it sustain you? What else can you do? So in economic inclusion, they are given money, 30,000 Kenyan shillings in 2 tranches. So they are supposed to do business with this money. So we have mentors, people who mentor them on the ground and teach them. And it's also a way of uplifting the community, the women and the men. What other businesses do you do that uplifts you? So the 30,000 mentors are there every day checking what do you do or you ate the money. So you must be guided on how to use the money. And a good part of it is graduation, which is also emphasized. You can't just be given throughout. At what point do you graduate and leave the others to get into the program? So that we also help the others. So those are there. And lastly, let me say that we also do training. We have a social protection training curriculum. I know some of the colleagues from the National Social Protection Secretariat in Ghana, they've come. In Gambia, they've come. We met them. As we speak, we have a group from Ghana doing the training. So it is good for us to learn from all areas. What do you do here? Well, how can we improve? Because just the way we said, social protection is a very fast-moving sector. Before you know it, there is COVID. Things have changed. Before you know it, drought, diseases. What else? So even the training is happening, and people do come for it. So those are the ones I wanted to add, so that as we are doing social protection, we know which areas we learn from each other, which areas we help each other, and that is it. Thank you. Asanteni.
Thank you so much. Please let us give them another round of applause. The Kenyan model now, we are all a witness to it. This presentation is not a brief one. It is a presentation for us to have a complete idea of how the Inua Jamii program is and what other programs exist in Kenya. So on that note, we want to thank them so much. We're working towards 12:30 for the closing ceremony to start. So I want to open the floor for a few questions so that we will allow our colleague from Ghana also to have time to present.
We have mentors and supervisors for these people who are constantly on the ground. They are trying to check. And agriculture is one of the areas. You can be given this money, you buy fertilizers, you farm, so that you improve. So it is literally in all areas, not just business of selling things. How do you improve yourself? So the graduation, I know there are some who have self-graduated themselves, seeing that now it is okay with me, I can come out. But there are some who are also still there, and it is being encouraged. The supervisors talking to them, such that when they see that you are uplifted, you can also come out. And if there are problems hindering you from really moving, they also intervene. Where is the problem? Why are you not really improving yourself? So that is what we are doing, and we are really hoping that once the timing will be over, the program is supported by World Bank. We'll then look at sustainability. Our Department for Social Development registers communities. That is why the program is under their docket, because community groups in the villages are used a lot. So we are checking on that. That is number one. I hope you are okay. The other area, the private sector. Maybe we didn't mention, but we work a lot with the private sector. UNICEF, like UCB, it's UNICEF running it. The Niche program, nutrition improvement, is a World Bank project, but being delivered under UNICEF. The UNICEF has taken that aspect. Then World Food Program is almost in all our projects. Social enhancing registry, this one for economic inclusion, the universal child benefit, and even the training which they've now handed over. Them and UNICEF, we worked a lot with them. But it is not only them. ILO is there. Recently, we even launched the informal sector social protection. How do we want to reach those in the informal sector with social protection programs? So we are working with them under that. And many more. Let me say, those are now the UN bodies. We now have the CSOs that we work a lot with. So it is a multi-sectoral. But in Nuajami, all that money, government took it over, pays all those people. That is they handed it over a long time. So that is the government. So the other people we are starting to work with a lot, and not even starting, in the Niche program and economic inclusion, in areas such as Marsabit, we discovered that so many people are not having national IDs. So we are working with the Department of Registration for Births and Deaths to issue these people with national IDs so that they can be in the program. The same happened in the UCB. We worked with the department. When we started, we realized that so many children were not having birth certificates, and yet it was a requirement. We registered some of them with birth notification. So under the program, we have made sure that all of them have now got their birth certificates. So those are areas we take cognizant and learn. In areas like UCB, another area we realize is child mothers. Do we have child mothers in Gambia? We have child mothers under 18, and you have a child and you don't have a national ID. So how are you supposed to be paid? Because it was through mobile banking, mobile cash transfer. And for mobile cash transfer, you must have ID. So we ended up, the mother to this child, we use your ID to register your daughter and your daughter's, can I call it your daughter's child or grandchild? So those are things that happen, and there are lessons for us. How do you move if you are to upscale it for child mothers? Or will you say we don't want child mothers? No, we must have them. So thank you. And just lastly, we have commenced a lot of work, even when you leave the people who don't have IDs, even with the refugees. There are now programs where we are working together. How do we bring them on board? Because even like any other country, we have a lot of refugees. So the UNHCR have come on board so that we see how do we work with them, even because they are here with us for a long time. How do we include them in our social protection programs despite not having the ID? So all that work is in progress. Thank you.
Thank you.
Thank you, Madam, and thank you for the good questions. I think there was an issue of, Madam has tackled the issue of the identification document, and I think for the program, Inua Jamii, it is categorical that you must be having a national ID. For those people who don't, for one reason or the other, don't have national IDs, we encourage them to nominate a caregiver. A caregiver is a person who represents you in the program. And that person must also have an ID. So that is the exact word. But also closely working with the Civil Registration Bureau to make sure that people who don't have national IDs are also issued with national IDs. It's also within the objective of the government for everybody to be identified through the National Registration Bureau. So we minimize those errors of exclusion because of documentations. There's the issue of the percentage in terms of the national budget, what has been allocated to the cash transfer. I think if you look at the budget for the financial year 2022-2023, we are looking at 1.2% of the national budget allocated to the cash transfers for the Inua Jamii. Our national budget runs to close to 4 trillion Kenya shillings. So we look at that because our national allocation for the cash transfers is around 38 billion Kenya shillings. So it's around 1.2% allocation. In terms of the transfer value, yes, 2,000 shillings a bit low in terms of the, if you look at the current exchange rates and the economic conditions. But there's always that question of, do we add the transfer value or do we extend the coverage to more beneficiaries? And I think what the country has focused on currently is to extend the coverage to more recipients, but the issues of the are cognizant of that fact that 2,000 per month is on the lower side, but communities are happy to have many people.
Thank you. So instead of saying thank you, we will say Allah Baraka. Oh, Jerejef. Allah Baraka. Yes. Thank you. Okay. This was a great presentation, and we've really we are motivated to have you once more anytime we have the opportunity. And for the social protection course, thanks to our able coordinator, he was able to facilitate, and not only one batch, it was 2 batches that went to, yeah. So a lot of us are coming, and then I hope many more trainings are done. Thank you so much for that. Our next presentation is the experience sharing from Ghana on the single window citizens engagement service, the equivalent of our grievance redress mechanism here in the Gambia. So I have the honor now to invite our friend, our guest. She has been here with us all along, Nadede Auntie, to come and deliver the presentation. Madam, you are welcome.
Thank you. Okay. Good afternoon, ladies and gentlemen. I think I'm really elated to have this privilege to share our experiences on our single window citizens engagement service. And I bring you greetings from Ghana, from the Ministry of Gender, Children and Social Protection, from our Honorable Minister and Chief Director. And I'm also grateful to the Office of the President for this initiative and the entire team of the National Social Protection Secretariat. They've done a very great job from sending the invitations and putting things together. And I'm here today, so I'll say I'm very grateful to you. And so I'll be giving a brief presentation. I know our time is fast spent, so I'll give an overview of social protection in Ghana, and then what the single window citizens engagement service is about, our channels of complaints, then our unified case management system, and some of our processes. And I'm going to share a few success stories with you. So Ghana's social protection before 2007 was dominated by traditional family and community arrangements and interventions by faith and welfare-based organizations, which I believe you have here. But research showed that this wasn't enough. And so in 2007, a national social protection strategy was then developed and gave birth to one of our flagship programs, the Livelihood Empowerment Against Poverty. This was later revised in 2012. And so the Ministry of Gender, Children and Social Protection was created in 2013 to provide oversight in the delivery of social protection in Ghana. And a rationalization study was conducted in 2013 that made some recommendations to strengthen social protection in Ghana. And so it's recommended that social protection in Ghana must focus more on the extreme poor and vulnerable populations, and also identify a basket of social protection programs, which I'll be taking you through shortly. And then the need to streamline social protection sector and enhance coordination and have a well-based and defined national social protection floor. And our social protection floor covers the entire life cycle, which I believe we also have here in Ghana, in Gambia, sorry. So in our social protection policy, we define social protection as a range of actions carried out by the state and other parties in response to vulnerability and poverty, which seeks to guarantee relief from destitution for those sections of the population who, for reasons beyond their control, are unable to provide for themselves. And I've mentioned the social protection floors, which include access to basic essential health care for all, with particular attention to maternal health care, and the minimum income security to assess basic needs of life for children, which is a priority at the ministry, and then a minimum income security for people in the working age and for older persons. So we have this basket of social protection programs in Ghana. We have the Livelihood Empowerment Against Poverty, which is a cash transfer program for the poorest households in Ghana, and they are in all the 261 districts and have a coverage of about 1,555,677, and the program targets orphans and vulnerable children, the aged, without support, and persons with severe disabilities who cannot work, and also very poor pregnant women and lactating mothers with infants under 1 year. Then we have the National Health Insurance scheme, which I know you also have here. And under the scheme, we have the indigents category who are exempted from paying premiums. So all the beneficiaries are exempted from paying premiums, and they fall within the exempt category, that's the indigents. Then we also have the labor-intensive public works that is implemented by the Ministry of Local Government and Rural Development, and is to provide income earning opportunities to poor households. And so this is done by self-selection, and priority is given to LEAP households and people who are very poor. And so the job is created based on what the communities need. So for example, they dig earth dams, they do cashew planting, coconut plantation, construct feeder roads, and seedling production, and others. Then we have the Ghana School Feeding Program, just as you also have here, which provides 1 hot meal for primary schools. And then we also have the Education Capitation Grants, that is to ensure that all Ghanaian children of school-going age, irrespective of their tribe and religion and political affiliations, have quality formal education and training at the basic level. And we also have one at the senior high level. And so during our earlier presentation, be able to have the best of services. When things are not going right, they should be able to complain and ask why, and be given the right services and quality services. And that is why grievance redress is a key feature when it comes to administration in social protection. And so Leadership and Transformation Curriculum 2021 defines complaint and appeal mechanism as a system that allows citizens to complain or provide feedback to the implementation of a given service, and allows implementers to respond to those complaints or feedback. And you agree with me also that complaints and an appeal mechanism is very, very important, and it increases the citizens' trust in the country and the implementing agencies. It also helps to solve operational issues and increases citizens' involvement and participation. And this also curbs corruption, because there's that transparency and accountability. And so that brings us to the single window citizens engagement service, which I believe you all want to know about and what exactly we do. So the Ministry of Gender, Children and Social Protection, as part of efforts to strengthen the social protection system, established the Single Window Citizens Engagement Service in 2017, and this has been supported by the World Bank. And so the mandate of SWES, for short, It's to coordinate and streamline social protection related grievance redress, to achieve efficiency and value for money, and serves as a single entry point for flagship programs which I've mentioned, the LEAP, the school feeding, the labor intensive public works, and the others. And then also, subsequently, the ministry realized that it had mandates over some other social issues. So the Single Window Citizens Engagement Service, also known as the Core Helpline of Hope Call Center, was expanded to receive complaints on other social issues within the mandate of the ministry. So we also receive cases on child and forced labor, human trafficking, domestic violence, gender-based violence, child maintenance, child custody, some legal issues, and the others. And then also in times of emergency, we also receive calls from people who need support. So for example, during the outbreak of the COVID, there was a lockdown in Ghana and people really fell into the cracks. So they called the center and we were able to provide support for them. So during national disasters, the Single Window Citizens Engagement Service is also used to provide support to citizens and beneficiaries. So the main objective of SWES is to improve transparency and accountability of the system by creating a unified complaints and grievance mechanism for social protection program. And so another objective is also to provide a single entry point for grievance redress of social protection programs. This, I mean, is that all the beneficiaries of the social protection programs are expected to channel grievances through the SWES system, and then we refer them to the appropriate agencies for redress. And it also serves as a single entry point for child and gender related complaints, and to also improve the quality of services that is being provided to citizens and beneficiaries. And finally, it also provides an independent complaint collection and monitoring mechanism to ensure that all the programs adhere to their rules and procedures. So SWES has two components. We have the helpline of Hope Call Center. You can see the picture of the call center there with the toll-free number 0800 800 800 or 0800 900 900, where we have call agents and case management officers there who speak about 9 languages. So we receive the calls in 9 languages so that everybody can have access to English and 8 other local languages. So that's the first one, the first component. And then the second component is the UCMS, the Unified Case Management System, which is web-based and a case management system that we use to receive calls in the cases, log in the cases, classification, referral, and resolution of cases. So when we receive the calls, it's this system that we use to log in the cases and also serves as a referral mechanism. So in the UCMS, classification of complaints is done under 4 levels. And the first one has to do with inquiries. So when call agents receive cases on inquiries, they are able to resolve it easily because we have frequently asked questions from the social protection programs, and they have trained our call agents and case management officers to be abreast with issues. So for basic questions, maybe when will the next leave payment be, or what do they do if they want to change a caregiver and all that. These are basic things that the case management officers should know on their fingertips, and they address it. And then the second classification is L2, which has to do with administrative complaints, and that one has to do with, for example, payment delays or data updates or caregiver changes. And for this one, we cannot do it as well, so we'll have to refer to the appropriate agencies, follow up with them, and ensure that they have resolved it for the beneficiaries or citizens. Then the third classification is there's the complex cases that has to do with fraud, corruption, embezzlement, and harassment. And when we receive such cases, we'll have to verify it before we classify it under the L3 and refer it also to the appropriate governmental agencies. And the last classification is the L4 that has to do with high level of calls that are directed at the ministry that sometimes have some media attention and has to be addressed. So these are the channels of complaints. We have the toll-free lines, we have our WhatsApp or SMS, we have our Facebook, our email address, the UCMS is there. And we have also developed a mobile app that makes it very easy for people to log in cases, but it's still at the testing stage. So at the decentralized level, they don't really need the laptop to be moving around and to just have their mobile phones there that they can easily use. So very soon we will be launching it. So as I mentioned, basically the UCMS is an information system for managing the filing of complaints, and so we use it to create cases, resolve cases, and then we close the cases. Now there was a problem which led to the creation of the UCMS. We realized that there was a lack of coordination and duplication of efforts among flagship programs in addressing the appeals and case redress mechanism, and we have to try our best to avoid duplication of efforts. There was also unavailability of consolidated case management reports for all social protection programs. We realized that different programs were given their own reports, but with this UCMS, we are able to retrieve reports, and we have one report. I mean, they all have the same thing. And then the cost of maintenance of different case systems. So it's important that we have a centralized case management system to be able to save money. I know, of course, we want to increase the coverage, we want to increase grants and all that. So all those monies can be used for that. It won't be like someone is taking the other person's job, but let's try to do the teamwork and then refer to the agencies. Then they also refer to the agencies for redress. So the objective of the UCMS was to establish a common support mechanism between social protection programs and avoid duplication, and also provide a 24/7 access to beneficiaries and others who want to lodge complaints. So with the UCMS, you can lodge complaints at any time. But when it comes to the call center, we are civil servants, so we work during the working hours 8 a.m. to 5 p.m. But we are looking at ways to expand the time so that we'll have people who work there for longer hours. So the UCMS does a number of things. It serves as a centralized common platform for management of cases and reporting. It's also used to support anonymous case reporting. If you don't want to mention your name or whatsoever and report a case, the system allows for that, and also provides a means of accelerating cases to higher levels. When a case is referred to a case management officer and it's not redressed within time, the system is able to escalate it to the superiors to address it. So that's how the system linkage looks like. We have the beneficiary or the citizen who makes a complaint. It goes into the system, and then we refer to the appropriate social protection implementing agencies. And then we also have an integrated referral pathways. So from SWES, you are able to refer cases to all the programs that you can see around the circle, which are in the social protection basket. We are not limited to the social protection basket alone. We have collaboration with other implementing agencies of social protection as well. And then they have also given us their referral or their case management processes. I know it's more here, but this is so as well as we know the case management processes that it goes through when we refer a case to them, and that is what we have in the referral pathway here. So this is the process flow for SWES. When a call agent receives a call, the call agent interviews the beneficiary, and if it's an L1 case, which I've mentioned, that has to do with inquiry cases, the case management officer is able to address it, and when the caller is satisfied, the case is resolved and closed. Now, when it's an L2 case or L3 case and has to do with an administrative issue, we have the senior case management officer who reviews the cases and makes sure that it has all the necessary information for the implementing agency to be able to address the issue. And then the senior case management officer also classifies the case. So when it goes to the social protection implementing agency, they resolve it there, and then they give us feedback. And all this is done through the UCMS, it's done in the system. And then also, we also counter check with the beneficiary and find out whether indeed the case has been resolved and he or she is satisfied. If they are satisfied, we resolve it in our system and close it. Now, if the beneficiary or the citizen is not satisfied with the outcome of the case, we will have to reopen the case, reclassify it, and then escalate it to the boss. So when the referral is done, it goes to the case management officer of the implementing agency. So SWES is a referral system. It doesn't mean that they are taking the work of the various case management officers. They will be there all right, but it's an independent complaint mechanism and serves as a check and a monitoring system so that cases will be addressed effectively and addressed on time. So when the case is escalated to the head of the implementing agency and he or she is not also able to address it, we have the subcommittee on case management made up of all the heads of the social protection implementing agencies. So the case will go there and they deal with overdue cases and then cases of appeal. So when someone is not satisfied with the case, the person can present that case to the subcommittee, and as the head, you are accountable for it and you'll be called to answer. And SWES is embedded in our social protection bill, and the subcommittee is also in it. So I'll urge you, if you have your bill and you don't have the case management in it, that's a centralized one in it, I think you can push for it. I'm told you have already submitted it, but there's always room for amendment and review. And this is going to put people on their toes and ensure that they are accountable to whatever they spend and make sure that they provide the right services for people. And so these are the people that the UCMS uses. We have the beneficiary, the call agent, and the case management officers, and the head of the case management. And these are also the channels through which cases are reported. So the beneficiary can decide to use the web portal, the email, the phone, or the forms, which I have already talked about. And as a case management officer, you are able to perform these tasks. You are able to manage teams. In the system, if you're a case management officer, for example, for the cash transfer, you have your team that you work with. So when we refer a case to you, you can also assign to your team members to work on it. You can manage tasks, you can resolve cases, and when you are not able to address an issue, you can also escalate it to your boss. And this is the complainer workflow also, that one can create a case, can track a case in the system. You can also log in or report a case anonymously, which I have already mentioned. So when one logs in a case, you're able to manage the case. You can update your case details and all that. And because of confidentiality, there are levels of access. Not everybody has access to the information in it. So the call agents can only log in the cases and they review or edit. The complainer can also just log in cases, review and edit. But there are other higher levels that has access to the details of the case and all that. And when you're a case management officer, we'll have to open an account for you so that you are linked in the system. So if you want to log in, just go to ucms.mogcsp.gov.gh and you are in the system. And this is how the interface looks like. Sorry. And so if you want to log in case, these are the processes, your username and password and the others. So in creating a case, you need some of these details to be able to create a case for it to be very meaningful. So these are the complainer requirements, your name, occupation, and other things to help us help you address the case. And once it goes into the system, you can see that these are the cases with their case numbers in the red. So these are details. When you click the case number, you'll be able to get the details of the case in it and follow up with the case. Then you can also make internal notes. So we are able to communicate with the case management officers of the implementing agencies once they have an account and they are able to give us updates on it. So all this serves as checks and evidence. So where the red button is, it's easy to edit and review cases there. And this was retrieved somewhere last week, about 2 weeks ago. I mean, you can easily retrieve a report and it gives you the number of cases that have been received on some of the programs that we have here. There's the LIPW. So for example, from January 3rd to 27th October 2023, we received 91 cases from LIP, and we have ensured that 86 have been resolved, and it goes for the other programs. And of course, we have other social issues which I mentioned earlier on, and these are the breakdown of cases. So it makes it very easy to have statistics like this, and we have a resolution rate of 90%. And then we also have the sex disaggregation. Interestingly, sometimes we have more males than females, and this is because some of the focal persons of the SP implementing agencies call on behalf of the beneficiaries to log in the complaints, which most of them are women. But for now, the system will record it as a male. We are planning to update it and put certain features in it so that we'll be able to have the actual number of males and females who report. That's why you have this vast difference. And then also I had a field visit in the northern part and realized that most of the women are afraid to complain. When they go through domestic violence and all that, they're afraid when they complain, they will lose their marriages. So we try to create awareness and encourage more women to complain and lodge grievances to us. So these are a few achievements. I've mentioned the subcommittee on case management, which was inaugurated and is operational now. And then we have also linked the UCMS to the social protection programs, and very soon we'll be linking our API with that of the LEAP management secretariat. And I mentioned that the system is used during emergencies. So we were able to facilitate access to dry food rations during the partial lockdown when there was the outbreak of the COVID. And then we also do awareness creation to get more people, especially those in the hard-to-reach areas, to patronize the SWES. For them, they'll have to fall more on the toll-free lines. And then the elites can also use the UCMS. So we have developed jingles in 9 languages, English and 8 other languages, to create more awareness and let people know that there's a helpline of Hope Call Center at the Ministry of Gender. So I'll share a few success stories with you. So during the lockdown, we supported them with the food, and you can see them holding it in bags. And then also there's a case on child labor. In December, a teacher reported a woman who patronizes her three nieces, 8, 10 years, and 12 years, for strenuous activities. So they were hawking and they were doing chopping of firewood, and that deprived the children from going to school. So the case was referred to the district social welfare officer. The woman was arrested and put behind bars for some time. And then the elders of the community sat together with her and advised her and all that. And then she was released. So we made a follow-up call, and we were told that the children are doing well and they are now back in school. So we're not only focusing on the social protection programs, but then all other social welfare issues and other things. And this puts a bit of fear into the officers, because once we refer it to you and we call and we tell you that this is from Ministry of Gender and we are following up on it, they try to do their best to address these issues. There was a case where we referred a case to a social welfare officer, and then the social welfare officer tried to take advantage of the vulnerable person instead of helping her, and it was reported to us that this was it. So we're able to call the welfare officer and said that, look, we are following up with this case and it is in our system. Quickly, he released all the money to the lady and she was free. So this serves as a form of check, and we have that backing. And then there's also a case on domestic violence. In December, we had a female calling us from the Greater Accra region, and she made a complaint that her boyfriend has refused to accept responsibility of her pregnancy. So she stated that her boyfriend forced her to terminate the first pregnancy in 2001 and promised to marry her but didn't marry her. She traveled to, I think, one of the Arabic states or Saudi Arabia or so, and then she realized she was pregnant and had to come back to Ghana. The boyfriend wanted her to terminate the pregnancy again, and she said this time, no way, she wasn't going to terminate the pregnancy. And so she brought the case to us, we referred it to the social welfare officer, followed up with the case, and finally the boy was made to accept responsibility of the pregnancy, and in fact he agreed to do the naming ceremony. So myself and one of my senior case management officers were at the naming ceremony to see to them and then to motivate them. We had something little for them from our pockets. Of course, we don't have that funding there, but sometimes when the story is so touching, we try to get something little for them to show them love. Then we also had a Ghanaian immigrant in the UK who also called us to complain about her husband who had come to Ghana to bring her 2 children to the UK. But according to her, the husband received the passport of the children and later on didn't want to take the children to her in the UK. So she called us, referred her to the social welfare officer, and later on when we followed up with the case, the woman complained that her kids are now safe with her and arrangements are now being made for them to join her in the UK. We have other cases on child maintenance and others. And then there's one also that a single mother called us for financial assistance. So we referred them to an NGO, that's African Women Initiative. Sometimes we need to get that collaboration with other NGOs because the government cannot do all. So you need to have them around you so that when you get such cases, you can refer them to them and then they'll help. So they did training for some of them. That's the lady in the pink, but I've blurred the face and stick. So she received a soft loan of 1,000 Ghana cedis, which she wants to use for petty training and trading, and later on she also wants to have skills in hair dressing. So we're still looking for more NGOs to support us with some vulnerable people who call us and need assistance. And then we also have this boy, he's from a LEAP beneficiary household. The grandmother called us that he was suffering from leprosy and couldn't go to school. And this was very worrying for us, so we had to contact the social welfare officer in that district, kept following up on the case and trying to look for support for her, for the boy. And they had operations for him to be able to go to school. So he is now in school, and that is the end of my presentation. And the success stories gives me joy when I go home that I've been able to help very vulnerable people. Thank you.
Thank you, Nadia. The presentation was good. You can stay. All right, thank you so much. I hope we enjoyed the presentation. This is exactly what we envisage will happen. The Ghana Citizen Single Window Citizen Engagement Service is something that we really admired when we went there. So we felt it necessary that we invite them to this conference so that they also present for the entire social protection sector in the Gambia to also learn from. And I know she did justice to the topic, and then I hope we have learned a lot from it. On that note, I would want to open the floor for questions again. If you have questions or reactions, I'm going to take 4. Okay, yes, madam. Any other? Or this time around, only one question. Thank you.
Thank you. Good morning. I am Sinabu Martin. Good afternoon, Rara. I am Sinabu Martin Sonko from Kerawan Area Council. I would like to first seize the opportunity to commend the Secretariat, the Social Protection Secretariat, the National Secretariat for organizing this very important meeting. And also to commend the presenters this morning from our colleagues from Kenya and Ghana. We have gained a lot from their experiences and their success stories shared with us. I have been here since the start of the conference, and I have been following the issues that have been discussed, and most of my concerns have been addressed. I only wish to call the attention, especially the Secretariat, the attention of the Secretariat, to one issue I have been observing because of my current job location and my interaction with the local people there. Normally we encounter these traditional madrasas, and the kids they have with them, you call them almudus. I don't know how to pronounce it or how it is called in English. Yeah. I have been very concerned about them, and having been opportune to attend this program, I have all along been thinking about how to raise their issue here and to call the attention of the Secretariat to their plight, to see how to incorporate them into the social protection programs. Because I feel they will grow to be somebody in the society, and most of them turn out to be our imams, our religious leaders. So it is very important that they are also taken care of, and to help, particularly their caretakers, their ustaz, because most of them, instead of focusing on their Quranic learning, they will be sent to the streets to seek for alms from people who are willing to help them. And I think this takes most of their time, like 80% or so, out of the time that they will spend on their Quranic education. So this is an issue that I haven't had been raised in this program, which I would like to share here and to know or to see how they will be considered in the program. Thank you.
Okay, Mr. Sedika. Okay, let me give it to Mr. Sedika and come back to you.
Good afternoon. I am Mr. Sedikan from the Office of the Ombudsman, and also the GRM consultant for National Social Protection Secretariat. That is the first GRM that was designed, and I think that system is still in progress until they change maybe to another system. So I thank the presenter from both the Kenya model and that of the Ghana model. Both models are progressive, and I think the way they are designed will definitely meet the needs, the grievances of the project beneficiaries or program beneficiaries when cases are reported. From the Ghana model, I've seen it's a centralized system in such a way that a legislation is provided by the Ministry of Gender to have a coordination and collaboration with different sectors within the Republic of Ghana. So that made it possible for them to refer cases to other stakeholders. So I want to ask, because there are classifications of grievances, that is cases. Classification number 3, that classify cases as very serious, like cases of fraud, corruption during implementation processes. When such cases are referred and a formal investigation is to take place, after the investigation, who does the recommendation? And after the recommendation, how is the implementation done?
Yes, thank you very much, and good afternoon to you all. I'm Pasha Tise, KMC. Madam, during your presentation, you do mention about a component that was spearheaded by the local government of Ghana. My question is, how much are they involved in the process, and what is their exact role and responsibilities? Thank you. Yeah, I said during her presentation, you do mention a component that was spearheaded by the local government of Ghana. My question is, how much are they involved in the process? And what is their exact role and responsibilities?
Thank you so much.
Okay, so I think the first one will be addressed by the National Secretariat.
Yes.
And then the second one on the level 3 classification, with the investigations and all that, everything is done by the implementing agency. So for example, if it's charged, they do everything. They will give the recommendations and then let us know. And then when they resolve it, we close it in our system. So we don't really play a key role because it's their work. So what we do is to monitor and to ensure that they have actually resolved the case and both parties are okay and happy. I hope I've answered your question, Mr. Naim. Okay. And then the third question, you asked something about one of the components. Is it the LIPW? Did you say how we are involved? How SWES is involved? Is that what you mean?
You said the local government.
How the local government is involved? Well, they are very involved because it's done at the district level. So they do the selection and everything with them. And then they select the people and then they give priority to LEAP beneficiaries and those who are very poor.
Thank you. Thank you so much, Nadede,
Am I
Auntie.
discharged?
Yes.
I'm discharged. Thank you very
so
much.
Give her a round of applause. Thank you. Please let us give her another big round of applause. Police Band, you are not helping us in clapping. Can you now help us? I mean you clap with the band. All right, thank you so much. I don't know how far is Philly and the team. We wanted to review the call to action paper before we move into the final ceremony. Our official MC is around. That is Jenava Sonko. Jenava, you are welcome to the podium. I think you have to discharge me now. Please give her a round of applause. Okay. The evaluation, Mustafa, can you project it now before the other team comes? It's projected. It's not. So they are projecting the evaluation. They want participants to scan it and then fill it online. Yes, and from there, Philly will come and then we'll read the call to action paper. We review and see. Over to you.
Good afternoon, everyone. It's so good to be back. And I actually made a plea last time, which is on Monday, to say when I come back, I want to see the same faces. I should apologize, right? For feeling that I'm not going to see the same faces the next time I come. So I owe you all an apology. And, you know, I must say I am really happy that all of you are here. And then I'm sure when we look at the position paper, we will see that every detail is captured, considering that we are all from different sectors. So like Malang said, currently we have the post-evaluation, so you can just simply use your phone camera. You just open your camera and then you just scan it, and then the form will come and then you evaluate us. So make sure to evaluate us the way you want to evaluate us, right? But I'm sure we'll be getting positive feedback from you all. I'm sure. I'm not trying to buy you guys in, but I'm sure we will have positive feedback coming from all of you. So, like Malang said, we will be taking a look at the position paper together and finalize it. And we're expecting that we will have our development assistant partners for social protection financing to join us shortly. So each and every one of them will be giving us a short statement where they'll be committing when it comes to social protection financing. And then after that, we will read the call to action paper, and then we will hand it over to the Minister for Environment and Climate Change, Rohi John Manjang, who will be representing the Vice President of the Gambia, and this will be handed over and read by Kodu El Jabang Sengor, Permanent Secretary, Office of the Vice President. So this is what we'll be expecting in a moment when we have our guests here with us. So meanwhile, while we wait, we can just still open the floor if there are any suggestions or comments, not questions, but suggestions and comments, if there exists any, while we wait for our guests to arrive, so that we can interact among us, maybe give recommendations, suggestions, if we are having to organize an event as such next time. What are some of the things that we can even look into? Because our rapporteurs are still taking notes, right? So these are things that can always be included in the processes when it comes to the organization of subsequent social protection conferences. So the floor is open if there's any suggestion or comment. Any suggestions or comments? Child Protection Alliance, I can see the head here. Any suggestions in relation to, the plight of children and social protection financing and how it can be channeled to ensure that, the plight of children is deeply looked into and the current dynamics? I'm sure there's one or two things you can share with us.
you're getting me on the spot again. All right, so thank you. I think one of the things that I've realized from that of the Kenya's presentation, when you look at the issue of the target, they have a clear cut of vulnerable children and children, orphan children. And I only hope that could be a good practice that Gambia should be able to have a clear cut regarding children. Because at the national level, what I've realized most of the time, that when you talk about vulnerability, children are blended in everything.
Right.
And when you come to the level, the higher level, you realize that they are not visible. Especially when you look at the issue of the cash transfer, the NAFA project, how do we see children benefiting from it? And I think this is something that we want to see on the way forward.
Okay.
Maybe my final recommendation would be, after the event, after the submission of the call for action, what next? And I think there's supposed to be some little bit of a roadmap. How do we create a monitoring mechanism to ensure that we don't only hand over a position paper to the government without being followed up? I think this is the one thing I want to recommend.
This is something that I talked about at the start of the conference, where I said we just hope it's not going to be one of those where we all gather here, put up a position paper, and then when we leave, it's not effective. I can give reference to, for example, the Children's National Assembly as a person who's responsible for children. The Children's National Assembly position paper from the last sitting was not adopted by government till this sitting as well. They had to do a recall to action because the actions weren't implemented. So we don't want to do another recall to action when it comes to social protection financing. But like I said, the stakeholders are here, including yourself, right? At the level of the National Child Protection Alliance, what can you do? What can other sectors do as well to ensure that we push this agenda forward? So we have another contributor.
Okay, good afternoon. I wanted to ask question, but Jana was said it's not time for question, it's just comments. Yes, so just contribution. My contribution will basically be on the social registry that is being developed by the Gambia. Currently, those of us working in the social protection space have seen that we have conducted, of course, data collection in the social registry in over 40 districts now. The only district or the only place left now is KM and Banjul. We have seen some challenges during the data collection. So this was highlighted probably by earlier presenters. But what is needed? When I look around, I see governors around. I see authorities around. The social registry is an important tool. In the case of presentation, they always get data. In terms of targeting, there is always a need for data. And in the Gambia, we have a unique opportunity by creating the social registry, and this is going into the social registry information system, where if you want to do social protection targeting, it's just a database that you can go and pick. If you want to target people living with HIV, you can get it. If you want to target the most vulnerable people, you just do the proxy mean text, you get it. But the problem that we have been facing as a country is anytime the data collectors are doing data collection, the way people respond, sometimes they give fake information. Some will even refuse to answer. And this is a challenge that we face as a country. There will be an update on the system, but we need forums like this so that those elite at the district level, at the community level, at the ward level can sensitize households to give the true information. I think this is important. I heard Mr. Lamin mentioning the NAFA program, how children are in. And this is important for everybody to understand how does the NAFA program targeting happens. It happens through the social registry. And the targeting is done at the household level. Our thinking is every household have a child, either under 5 or above 5. But there is a child there. So the program is also having some other elements. That is not only cash transfer, but social.
update us about the work that you are doing in the regions, and how are you just dealing with social protection at regional level? We're happy about the fact that this is decentralized, you know. So you won't answer questions, but you will just tell us, you know, at regional level how work is going. Yes, please. Thank you, Omar. You want to have that too? Okay. It seems I understand, Omar, but still, we appreciate the work that you're doing in the regions. It seems Omar actually has a surprise package for us when it comes to the work going on in the regions, and he does not want to disclose it to us right now. So that is the whole point. So when it's done, when these activities are done, Omar will get to disclose the amazing work that they're doing at the regional level. Yes, sure.
Thank you very much, moderator. I want to seize this opportunity to thank the organizers and, of course, the presenters from Kenya and Ghana. For your information, the one from Ghana, I am Harun Abaji. I work at the Ministry of Gender, Children and Social Welfare. So you have your partners fully represented here in the Gambia. For me, I think, I don't know if, I know for sure the repertoires may have been taking stock of the deliberations and, of course, the various suggestions and comments. But equally important also is to kind of put in a proper checks and balances in place so that at least 2 years from now, we will probably come back here or any other part of this country and take stock of the call to action paper that have been drafted in 2023. I know sometime in 2021, we were in this very hall, and I can fully remember that a call to action paper was drafted. How far have we gone in the implementation of what we have agreed upon?
Bring financial services to the doorstep of the poor with donor projects, madrasas, youth organizations, women groups, and farmer organizations. Make a choice with Yona Islamic Microfinance today. For more information on Yona Islamic Microfinance, call 377-2151 or 9832-151 or visit Yona head office at Thipa Garage, Bakote, or visit any Yona branch located countrywide near you.
Agada di.
Mbijan aganya.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la sto.
Ha, code nyinji.
Okay. What's Nsila ID soto.
Sa soto. Sorry. Agada di.
Mbijan bro.
Albaka.
Mbaka.
Bara alla service o tariaka.
Bare
mo ki janna nun kunu bara tariaka.
Jannom yona forest de bureau. Gambia tonkon na no mbali ya bere. Birin koyna fo kato.
Bari si kodo kino kato nim fo bolong labe.
56 branches mola soto Gambia jang.
Ha?
Gambia kono ani Gambia bantala bankol. Nko kono kiya bere. Kodo sifa fo falindiro fo nyaadi lafta memmen na kodi to poto nim kodi maro. Jannom number 1 ti nyonta. Andum fana nata anoda enterprise sotale. Wolam nyindi ko domorol fana kol fana be firale de dadi mani domorol dil fana beteat. Gambia dawda yalo ngam fa kendol sotale je.
Wo moyo diat.
Apelen da
barka. Ni ma lafta nyelen kendol e binaji.
Yalo bukani la ko la barka ba.
Yalo ndel chosano lo.
Barka.
Thank you so much, Police Band, for being with us since the start of the conference. So we can just pray in our own individual ways, please.
System that are present. So the call to action, the report was presented. The detailed one that we have summarized. That is the one that will be read. Okay.
Yeah, so thank you so much, everyone, for being with us for the past 3 days. It has been an amazing conference. So we're also happy that we're joined by the Minister of Climate Change and Environment in the Gambia, Rohi John Manjang, she's delegated by the Vice President of the Gambia. But I think this is a very good delegation, considering the fact that we are all aware of the challenges when it comes to climate change related matters that we get to deal with as a country on a daily basis. So it's good that she's here. As a sector that there's a lot of social protection financing that should be channeled through disasters and climate change related matters. So thank you so much for joining us. So moving on, we are aware that currently in the Gambia, social protection programs are not fully funded by government. And most of the programs that we get to benefit from as citizens of this country is usually funded by development partners. And we want to recognize their efforts. So because of that, we'll be inviting the different development partners to actually give us their commitment when it comes to increasing social protection financing. But in as much as they give us their commitment, we are also, as a government, going to be motivated by the amazing work that they're doing when it comes to financing social protection programs to say we are also committing as a government and as the people of the Gambia to look for ways to also internally increase social protection financing, which will bring about the sustainability that we're talking about as in the team. So first off, I would invite the Deputy Representative for UNICEF to give his commitment. Thank you so much. A round of applause. UNICEF has been a very, very important development partner when it comes to social protection in the Gambia, and particularly to the National Social Protection Secretariat. We appreciate your efforts.
Honorable Minister, colleagues representing UN agencies, ladies and gentlemen, my name is Armand Yaouré and I'm the Deputy Rep for UNICEF. As you know, UNICEF has been supporting social protection system in the Gambia for years now. And this is one of the key priority areas we will continue investing in. We are currently finalizing the development of our new country program, and in this country program we'll have social policy as a key program component. In addition to the support we provide in sectors like health and immunization, nutrition, water and sanitation, education and child protection. So having a fully dedicated program component related to social policy and including social protection will enable UNICEF to strengthen and increase the support that we provide to the system. And of course, this is part of the contribution of the UN system in the Gambia to the National Development Plan. And to give you few ideas of areas of our support, of course, in addition to the coordination mechanisms that are important for the national social protection systems and mechanisms, we'll continue supporting data collection and management systems, and also give priority to areas like public finance for children, and also expenditures for the most vulnerable people. Our support will also cover key areas, including acceleration of social protection coordination, as I earlier mentioned, but also information management systems to inform programs and measure delivery and feedbacks. We'll also increase our support to accelerate advocacy in public finance for children, for more spending and better spending in social protection, particularly gender and child responsive social protection. On top of that, through our support, we'll also have a focus on accelerating engagement of National Assembly to improve oversight functions of budget processes. Capacity building is also key in the support provided to the national social protection systems. So that will also be part of the support that we want to focus on, including building capacity of adolescents and youth in budget processes to increase citizen participation. And also, as UN agency, as I earlier mentioned, our support will also be to participate in interagency social protection mechanisms to support the implementation of the NDP and of the collaboration framework that the UN system has with the Gambia. Now, this is complementary to what we are doing in other sectors, as you know. The support we provide, for example, in education. Most of you know the blue bags that we provide in schools, but also the support we provide in health, nutrition, water and sanitation will continue, will be strengthened with more resources allocated so as to contribute to the achievement of the National Development Plan. So I will end here confirming our full commitment as UNICEF to continue our support and to thank the National Social Protection Secretariat and the Vice President for the leadership and for all the work that has been done so far. Thank you so much.
Thank you so much for recommitting, because you've already been committed throughout, you know, the processes like you pointed at. While he was recommitting to support social protection, I saw some of the social protection staff smiling over there because they felt like, oh, our work is going to continue with you know, these commitments that we are receiving from UNICEF. So thank you so much. A round of applause for him once again. So up next, we all are aware of the importance of food in the country, and when disasters hit, we all understand that it is important that food is available. When people have food, they're able to have the energy to continue to work, to even produce further. and we have a specific body that has been very supportive when it comes to this area. And the FAO Deputy Country Representative is here with us to join us here to also recommit, because they're already committed and we are already aware of their efforts, to recommit to supporting social protection programs in the Gambia. Thank you so much for joining us. Oh, okay, so I was informed that we have the FAO. I was informed. Yes, FAO, sure. Yeah. A double F, yes, so we're welcoming the FAO representative. A round of applause for him.
Yes, thank you very much, Chair. Honorable Minister of Environment, Climate Change and Natural Resources, Permanent Secretaries, Deputy Permanent Secretaries, Directors, and staff of government institutions here present, governors and area council representatives, members here present, members of civil society organizations, members of the press and print media, ladies and gentlemen. FAO is privileged to support and to participate in this International Social Protection Conference 2023. FAO recognizes the critical role social protection plays in ensuring and accelerating progress around food security and nutrition, in agricultural development, in social poverty alleviation, and in resilience building. FAO social protection actions are guided by the FAO social protection framework. And the framework has a vision, and this is to ensure that people and communities living in rural areas, as well as those whose livelihoods depend on natural resources, are supported by social protection systems. It is also essential to help in ensuring that their food security and their nutrition security.
Have not really enough emphasized the fact that it was not a journey that they took alone. The partner with the World Food Program has been involved since the beginning, and for Ghana as well. And as the Excellency has articulated at the opening of the conference, the World Food Program is committed in its mission to fight hunger in the country through different initiatives, including the school feeding and the food cash transfer to households during the most difficult time of the year, like the lean season. I say this moment to emphasize that this year we have expanded the macro insurance coverage in the Gambia, assisting the most vulnerable smallholder farmers impacted by extended period of limited rains. This initiative mirrored the government effort in disaster risk financing within the country. Furthermore, the World Food Program has been supporting as well rice fortification effort with the objective to enhancing nutrition for school-aged children. It has been widely acknowledged that this conference, that a robust social protection mechanism are vital to mitigating the adverse effect of poverty on the most vulnerable families. And we know that as well the repercussion of poverty and food insecurity manifests as worsened, school dropout rates, impeding the education of children and perpetuating as well the cycle of poverty across generations. So World Food Program is dedicated to the future of social protection programming, as outlined in our
food self-sufficiency, the human capital is complete. And I said on the first day that what we should all look forward to always is the development in the human capital, because it's something that people cannot take away from you. Any kind of training or advancement that you have in terms of your human capital, nobody will be able to take that from you. So we thank the partners I mentioned. Social protection, everyone said for the in the last 3 days, is a multi-sectoral thing. So when you say social protection, you shouldn't think only about the Social Protection Secretariat. In fact, the Social Protection Secretariat doesn't implement any program, and we want this to be very clear. The Social Protection Secretariat does not implement any program and have no intention of implementing any program. However, we feel mandated by the social protection policy in support of government's dream, which is to have by 2035 an inclusive social protection system. Now recently, just to show you our commitment to what the policy said, we discussed a project with the AFDB. It has interventions in social services, in early childhood education centers, in Tibet centers, and also to provide entrepreneurship training. We are coordinating the project. Of course, I'm going to be the project coordinator. But all the activities in the project will be implemented by partners outside. So it's a clear indication that social protection implementation is for the MDAs, is for other partners, not for the Secretariat. But we will continue to work with the partners to ensure the coordination envisaged in strategic priority 5 of the policy is realized. So we thank the partners for your support in the different MDs. And also, the conference looked very elegant from outside. Thanks to your generous support, financially also, all the partners contributed, which we appreciate very well. We also would like to thank senior government officers here who continue to play a pivotal role in the steering committee meetings. We have PS Dara from the Office of the President here. We have a permanent member from the Personnel Management Office, DPS Musa Jam, who's been with us for the past 3 days. We thank you also for the support. That is DPS Bintu from Agriculture, DPS Sanyam from Education. We thank you all for your support before today and for agreeing to be part of the panel. Of course, it wouldn't have been called the Gambia International Social Protection Conference if it was only for participants from the Gambia. So we are grateful to our resource persons from Ghana, from Kenya, also our resource person, Chris, from Belgium, head of the Social Protection Research Institute in Belgium. So at his age, he was able to willingly say that I will come over to the Gambia and present. At his own resources and cost, he decided to join us. I think we should give him and the rest of the resource persons a round of applause. We appreciate your coming. And then let me just put in context the two delegates, the Kenya one and also the Ghana one. Now, the National Social Protection Secretariat is working on a unified GRM structure. We are looking forward to a time when every project that comes doesn't need to have a GRM. Before we are ready, all our toll-free numbers will be finished. We want to have a unified call center where all programs can use to have their grievances addressed. For that reason, we appreciate the contribution and support from Ghana. Nana, thank you so much for coming. Now, the Inua Jamii program is the government of Kenya funded social protection program, which mainstreams social protection into the budget and ensure that it's predictable and they continue to expand. Now, those who were here on the first day, we remember His Excellency the Vice President talking about the partnership with the European Union to roll out or scale up the family strengthening program as a pilot of mainstreaming social protection. So we are basically trying to mimic what Kenya is doing. And of course, the Minister of Finance also gave his support to this. So for 2024 and 2025, we are starting small. And I was very happy when you saw that when you started the Inua Jami program, it was 500. You started with 500. 500. Now we are starting the pilot. Of course, the program was already there, 150. So now we're scaling it up, basically on the OVCs, on the older persons and people with severe disabilities. Presently, the program is supporting 150 individuals. So we are scaling it up to 3,000. And at some point, oh, that's still small. So population-wise, if you divide 3,000 by our population, and you divide 500 by Kenya's population, per capita, I think we should be fine. Yeah. So let's start small. As we stated from the first day, there will be an evaluation that will be set up from the start, which will inform government on how to continue to scale up. And the big dream in terms of social protection reform is that we will mainstream social protection and we will encourage partners, all of them. Of course, they are doing now. UNICEF is going through the country system to support the coordination structures. But this is the direction of government in line with the Paris Declaration of Aid to use government system for implementation. So we thank the resource persons for supporting endeavors that we already start. Now the governors, who are heads of the subcommittees at the regional level, 2 of them are with us and the others have their deputies here. We thank you for coming. We also thank the CEOs of the councils. We recognize their presence and their contribution. Of course, I should end with the organizing committee, but we cannot proceed with anything without our parent ministry. And the permanent secretary, Office of the Vice President, is with us here today. We thank her for her unconditional support all throughout the process, and everyone else coming. So the final people, before I come to the organizing committee, is the participants. If we are only empty halls today, probably we'll all go home. But yesterday, even at 5 p.m., people still wanted to ask questions. So we thank you for your commitment. We thank you for your commitment. So as per the guidelines, the organizing committee members, please, you may join me. If you agree that I'm part of the organizing committee.
Yes. Is he part of the organizing committee?
I attended 2 meetings, but they said that was not good enough. Anyway, please, I invite you all in front to see for everybody.
Should we give them a standing ovation?
Yes, yes.
Should we do that? Please. They did amazingly well. Thank you.
So while they are working, let me also, although I am not a member of the committee, as they claim, but I want to give you the secret of this team. As they are moving on, okay, just media. All right, thank you. Okay, thank you very much. I think probably all of us were informed at one point that they saw us on the TV. So a big thank you to the media for being with us for the last 3 days. Now I cannot do justice to the gathering without telling you what the secret is. If you look, it's not only the Social Protection Secretariat staff. It comprises participants from different ministries, from development partners. And at no point did the permanent secretary or myself interfere in their work. They constituted subcommittees and worked on them. Whatever they gave, at one point I told Philly and Madam, whatever comes from the committee, I cannot change. So it shows the power of teamwork. It shows the power of getting ideas from other people, even though you have the mandate to organize, but the power lies in the group. So I wanted to share that with all of you. Thank you, everyone, and I think we can give them a round of applause.
Thank you so much to the organizing committee.
I have to stand. I think I'm
Yes, for the picture. Thank you so much to the organizing committee. We all understand the challenges of organizing 3-day conferences and the fact that it's very diverse, but particularly thumbs up to the women in the committee. A round of applause to the women. I am sure you came up with the, creative ideas. I'm sure. All of the creative ideas. Thank you so much to the organizing committee. Thank you. Thank you. So moving on, We attended this conference for 3 days, and the reason is because we all came to bring our heads and hearts together to commit to increasing social protection financing and just generally increasing the social protection programs in the Gambia. And different commitments were made, different suggestions were made, and now is the time for us to invite the Permanent Secretary of the Office of the Vice President to read out the commitments and the recommendations that you came up with. So a round of applause for her. Thank you so much.
Thank you so much, Jainaba. The Honorable Minister of Environment, Mrs. Roy John Manjang, the Deputy Representatives of WFP, UNICEF, FAO, colleague permanent secretaries here present, senior government officials, governors, mayors, international delegates, civil society and private representatives, representatives of the media, as well as press officials, staff and heads of institutions under the Office of the Vice President. I see the Deputy ED of NANA, Early Warning Center, as well as Momodu Diba himself. I stand here this afternoon to basically present to you the Gambia International Social Protection Conference 2023 Outcome Statement. The outcome statement was prepared by the participants at the first International Social Protection Conference under the theme Accelerating Social Protection Financing to Increase Coverage and Reach, held at the Sadauda Kaira Bajawara Conference Center from the 6th to the 8th of November 2023. The international conference reaffirmed continuous commitment towards building a responsive social protection system with particular focus on sustainable public financing to ensure everyone is covered and reached with the minimum package of social protection services. The international conference was attended by over 100 participants from government, private sector, civil society, faith-based organizations, development partners, and participants from other countries. Agenda, children, and shock-responsive social protection system have been noted to be a key driver to improving lives and livelihoods of vulnerable populations. Investing in social protection programs has been emphasized as an important lever for achieving the Green Recovery-Focused National Development Plan 2023-2027 and the Sustainable Development Goals, SDGs. The international conference focused on exploring new funding opportunities, both domestic and external resources, to ensure efficiency, equitable, and effective delivery of social protection programs. Delegates were able to share progress, discuss challenges, and explore opportunities towards financing social protection in the Gambia. Thus, participants agreed on the following priorities and recommendations. Priority 1, ensure continuous implementation of National Social Protection Policy 2015-2025. To achieve this priority, the recommended actions are: for the national level, in particular in relation to the executive, it is being recommended that a proper human development policy be developed that will respect, protect, and fulfill the rights of everyone, especially children and women, irrespective of background, religion, ethnicity, disability, or any other consideration or status. Accelerate the implementation of the National Social Protection Policy through multi-sectoral and integrated approaches. And lastly, strengthen strategic partnership with traditional partners and map out new resource mobilization opportunities for implementation of the National Social Protection Policy. For the legislature, it is being recommended that a social protection bill be enacted to support implementation of the policy. Secondly, enhance National Assembly oversight function on social sector budget process. Priority 2, increase public investment in social protection. To achieve this priority, the recommended actions are: for ministries, departments, and agencies to increase budgetary allocation into gender, child, and shock-responsive social protection programs. Increase budgetary allocation to the family strengthening program. Review the family strengthening program to strengthen capacity for increased coverage and reach. Expand coverage of school feeding programs nationwide. Increase school bus services and provide appropriate means of transport for children living in hard-to-reach communities. Increase provision of educational services, infrastructure, teaching and learning materials, and digital skills. Increase access to sanitary kits for girls. Increase availability and access to disability-friendly social services. Improve availability of basic health services, reproductive health care, immunization, civil registration, and vital statistics. Increase cash transfer to poor households. Scale up climate-smart investments, agriculture, environment, human settlement, etc., to prepare and respond to shocks. Increase labor market opportunities for enhanced productivity. For the private sector and development partners, the recommendation is to see to it that there is mobilization and institutionalization of new social protection funding opportunities, faith-based, such as Islamic zakat, diaspora, philanthropy, and citizen participation. Reinforce private sector in social protection drawing lessons.
We apologize for this. I'm sure they're trying to put it together. Yeah, it's back.
Reinforce private sector in social protection drawing lessons from COVID-19 experience. Enhance development partners' investment into modeling social protection programs to inform government policy. Enhance government access to concessional loans, grants, special drawing rights, and debt for social protection. Priority 3, strengthen social protection program coordination, monitoring, and learning. To achieve this priority, the recommended actions are for the National Social Protection Secretariat to strengthen the National Social Protection Secretariat coordinating mechanism to facilitate joint programming, monitoring, and learning. Ensure impact assessment of social protection interventions to generate evidence for advocacy, inform government policy, scale up, and learning. Continue to build a social registry to inform social protection program targeting. Create a national mechanism to improve information management systems. The CRVS example, Farmers Registry, the National ID, and so forth. Strengthening the grievance redress mechanism. At regional level, regional social protection subcommittees. It is being recommended that these committees be strengthened for social protection coordination, monitoring, and learning at regional level. For local government authorities to mobilize resources to expand access and coverage for social protection. Considering all critical issues discussed during the 2023 International Social Protection Conference, the outcome statement is not exhaustive of important matters and will be subjected to review and update based on emerging issues. We once again reiterate our commitment of ourselves, the commitment of ourselves, I repeat, towards sustainable public investment in social protection. With that, ladies and gentlemen, Honorable Minister, distinguished ladies and gentlemen, we come to the end of the delivery of the outcome statement, and I thank you all for your kind attention.
So, P.S., I'll just keep you here with me so that we will do the official handing over. But we just apologize for those interruptions here and there, which is beyond our control. But I'm not sure if we have a representative from NAWEC. Do we have a representative from NAWEC? Or the energy sector? They are not here, but anyway, we will leave that to them. So we will just now allow you to hand this over to Mr. Suleiman Jallo, and we will invite the Honorable Minister for Environment and Climate Change to, when you hand over to Mr. Jallo here, he will hand it over to the Honorable Minister to hand it over to government for implementation. Yeah, so we can just take a picture here. Yes. But like the statement said, it is subjected to review and adding issues as emerging issues come. Yes, so you can just hand it over to the Honorable Minister of Environment and Climate Change. Thank you so much, and thank you to the participants for putting this document together. So like I was saying, thank you so much to the participants for putting this document together. And hopefully, just to tease Nawek, maybe we should have a portion where we talk about energy, increasing energy access. How should we call it? So we'll come up with that in subsequent engagements, right? Access to energy. But we will now invite the Honorable Minister for Environment and Climate Change to deliver her statement on behalf of the Vice President of the Gambia. Thank you so much for joining us. A round of applause for her.
Assalamu alaikum wa rahmatullah. A very wonderful good afternoon to you all. I recognize the presence of P.S. Kodu, who has been also very active in the entire process of the secretarial as the permanent secretary for the ministry, for the office of the vice president. The UN representatives here present would allow me to recognize WFP, the UNICEF, and the FAO. I want to inform all of you here that I am a beneficiary of the WFP food program. From primary 1 all the way to primary 6, no interruption. I still remember the Friday stew that we have for the country. I don't know who among you can remember that. And the morning milk that we have with the biscuits. I still fully remember it as if it is today. Thank you for giving us all the right to achieve our education goals. The EU ambassador, if present or not, we thank them for being a very close partner to this achievement. Other permanent secretaries here present. Of course, my former colleague governors, I can't miss you. And other deputy governors representing governors. The area council representatives, but I want to also recognize the presence of Nana as the former committee member, PSC committee member. I know the role that they have played to support the establishment of this secretariat. International delegates, members of the private sector and civil society organization, all protocols duly observed, and of course, our able Madam moderator. Distinguished ladies and gentlemen, a special good afternoon to you all. Not forgetting the media in front of us, very visible. I am honored to step in for His Excellency the Vice President, who is unavoidably engaged on other pressing national needs, to give the closing remark on his behalf for this important and first of its kind international conference on social protection in the Gambia. This occasion marks another milestone in the history of our country as we gather here to discuss a key development priority for the world in general and my government in particular, and as stipulated in the Sustainable Development Goals, the recently concluded National Development Plan of the Gambia, and the newly adopted Green Recovery Focus NDP of the Gambia. Let me express my gratitude to the organizers who have just been paraded in front of us for a wonderful and special organizing process, and also to our development partners in country and beyond. I equally wish to thank all the speakers, the resource persons from within and outside the country for graciously accepting our invitation, even in some cases at a very short notice. All these are reflections of a strong interest and support we all have towards improving the well-being of the poor and vulnerable people in the Gambia and the entire world. Distinguished guests, ladies and gentlemen, the presentations we had in the last 2 days and the related discussions has given us an idea of the current state of financing and coverage of our social protection efforts, justifying for our collective conscience and commitment to do more for the well-being of our people. Like in many developing countries. The social protection sector in the Gambia is challenged by a number of issues. Key of this is inadequate funding, which limits coverage of social assistance services and social security schemes, weak or no legislative frameworks and coordination mechanisms, which affects, of course, the delivery mechanism, and this is indicated by the poor data and integrated monitoring and evaluation system that we have in the Gambia. The mic is behaving funny. I hope I'm not going to get in my tone of interruption. In our response to these challenges in the Gambia, government has formulated the National Social Protection Policy with the long-term goals of establishing by 2035 an inclusive, integrated, and comprehensive social protection system that will effectively provide protective, preventive, promotive, and transformative measures that will safeguard the lives of all poor and vulnerable groups in the Gambia and contribute to broader human development, greater economic productivity, and inclusive growth. Based on this strong belief and understanding that progress in social protection has positive effects on several other sectors, the government of the Gambia has undertaken a number of important steps, including principally the establishment of a central coordinating mechanism, the National Social Protection Secretariat, to serve as an implementing arm of the National Social Protection Steering Committee in providing leadership, and the Social Protection Steering Committee in providing leadership and coordination across the country. I here thank the coordinator of the Social Protection Secretariat for a job well done these past years. The Secretariat has been executing this mandate by proactively working with all providers of social protection services at national, subnational, and international levels. As you heard in the presentation of the National Coordinator in day one, the Secretariat has registered significant progress in several areas, including development of the Gambia Social Register and the production of an annual sector-wide report on social protection. Thank you for the coordination. Distinguished ladies and gentlemen, the directive to use the Gambia Social Register for targeting the China rice aid distribution, the NAFA cash transfer, the root projects, agriculture input, support, and cash transfer are indicators of the high level of importance that government attaches to addressing fragmentation and improving coordination in the sector. Let me at this point say that henceforth, all government institutions and development partners involved in supporting our vulnerable and poor people are encouraged to work hand in hand with the Secretariat. This will enhance synergy and ensure effectiveness and efficiency in the social protection service delivery in the country. It is important to note that Cabinet has approved what is going to become the first ever legislation on the Social Protection Bill for inaction. This important bill will help government to put in place the right institutional framework and long-term strategy necessary to facilitate the realization of the right to social protection in the Gambia. Similarly, enormous effort geared towards improving welfare of the most vulnerable and the poor continues to be invested across education, the health sector, agriculture, environment, energy. So we'll start not only to have uninterrupted, but efficient and clean energy. Gender, the youth sector. Government stands ready to intensify these works to expand coverage to all the deserving people of our country, then leaving no one behind. By the same token, we call on our development partners to scale up support for the poor and vulnerable people in the Gambia by enhancing government support and increasing the funding gap. Distinguished ladies and gentlemen, allow me to recognize the significant budget support of the European Union, which allowed government to strengthen its family strengthening program and increase coverage from 150, as stated by the coordinator, to 200 next year, and the upper year to 2,000, and then the upper year to 3,000. It is small in number, but I will tell you, as explained by the coordinator, looking at our size and a starting point, you grow small, you grow big, you start small and grow big. So I applaud our development partners, the EU, for helping us to grow big. I would also like to mention the contribution of the World Bank towards improving livelihoods through the example of the various social safety nets programs in supporting its various sectors in the Gambia. The UNRC for leading the UN's cooperation with government, and the World Food Program, whom I am a proud beneficiary, for the school feeding program and other livelihood enhancement intervention. Thank you for your partnership and long relationship with the government of the Gambia. The UNICEF for their continued support to the future of this country, especially women and children. And the UNDP for their commitment to ending poverty and improving human welfare in the country. FAO for the support to our farmers in our food security drive. Thank you. WHO for standing by our health sector and services for better health for our people. And again, the UNFPA for supporting our young girls and women, among others, and all other UN agencies and development partners for their unflinching support to the government of the Gambia and its people. Thank you all. I've not finished, I'm thanking the UN body. Okay. I have a long statement to give. This is the Vice President making statement. Thank you for your understanding. Given the current economic challenges of the Gambia and the development issues to address, the effective implementation of our national social protection policy and registered strategies will require significant donor support, and why I am happy to see people signing their commitments. I therefore thank all development partners, both those that pledges today and hopefully those who will do the after here, for generously pledging their commitment and resources towards increasing financing for social protection. We look forward to the actual implementation of this commitment. We have no doubt that this commitment will translate into actual disbursement for enhanced coverage. I have taken note of the recommendations in the call to action paper and pledge the commitment of government in implementing them. The poor people of the Gambia and the world deserve to see these recommendations implemented as soon as possible. With those remarks, I declare these 2 days, successful 2 days, the Gambia International Social Protection Conference officially closed, and wish everyone safe back home and a future of success. Thank you all.
Yeah, thank you so much, Honorable Minister, for that brilliant statement on behalf of the Vice President of the Gambia, and to all the development partners. Thank you so much for recommitting to support social protection in the Gambia. Once again, to the participants, thank you so much for putting together the document, and also to the organizing committee of the National Social Protection Secretariat and other sectors in the organizing committee. Thank you so much for organizing such an... Yes. Sure. To the to the police band. Yeah, thank you. No, and she forgot me. Oh, she mentioned me. And yeah, she did. And I'm so jealous of her as well for benefiting from the school feeding program, with WFP. Thank you so much, and to all partners. And now it is left to us now to go back to our respective sectors to ensure that we implement some of the recommendations that have been given here. That is what we want, so that when we gather next year, it's not us recalling for action, but actually identifying areas where actions have already been taken and that improvement is what is needed. And to the sign language interpreter, thank you so much for being here with us. As social protection, obviously, we have to be inclusive. We have to be inclusive, and that is what we have been doing. And to our international delegates, to our regional delegates, thank you so much. So wish you all a successful rest of the day. Bye. Thank you. And now we can just head right on to lunch. Yes, we can head right on to lunch. So we can just have the high table to leave, to head to lunch, and then...
Islamic microfinance is becoming an increasingly popular mechanism for poverty alleviation, especially for developing countries around the world. This microfinance service adheres to the principles of Islam as a form of social responsibility. Yona Islamic Microfinance is the Islamic microfinance of choice in the Gambia, trustworthy and reliable. At Yona Islamic Microfinance, we provide savings products, current accounts, financing products in conformity with Islam. In addition, Yona Islamic Microfinance also offers local and international remittances, takaful fund, management of zakat, management of awqaf, trading and investment, and building of strategic partnerships to bring financial services to the doorstep of the poor with donor projects, madrasas, youth organizations, women groups, and farmer organizations. Make a choice with Yona Islamic Microfinance today. For more information on Yona Islamic Microfinance, call 377-2151 or 9832-151 or visit Yona head office at Tipa Garage, Bakote, or visit any Yona branch located countrywide near you.
Agada di.
Mbijan raganya.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la sto.
Ha, code nyenje.
Okay. Korsa. Nsila ID soto.
Ah, sa soto. Sorry. Agada di.
Mbijan bro.
Albaka.
Mbaka.
Bara Allah service o tariaka.
Ah,
bare mo ki janna nun kunu bara tariaka.
Ah, janno yona forest de bureau. Gambia tonkon na no mbali ya bere. Ha. Birin koyna fo kato
bari si kodo kino kato nim fo bolong labe
56 branches mola sota Gambia ja
ha
Gambia kono ani Gambia bantala bankol nko kodo kiya bele kodo sifa fo falindiro fo nyaadi lafta memmen na kodi to poto nin kodi maraw jannom number 1 ti nyonta andum fana nata anoda enterprise sotale wolam nyindi ko domorol fana kol fana be firale de dadi man domorol dil fana beteat Gambia dawda yalo ngam fa kendol sotale je
ha e wo moyo diat ha
apelenta
baraka ba ya lafta nyelen kendol e bina
yalo bukani la ko la baraka ba
yalo ndel ciosano la
baraka